All right, we are live. You guys can start the meeting.
Mayor Petty, we are live now. You can unmute yourself.
I was talking there, but I was muted. Anyways, we have over 300 people, I think, right now on the line. And I just want to welcome everybody to the reopening of the Worcester Public Schools. Before I continue, we're just going to ask Helen Frail, this clerk, to do a roll call of the school committee.
Ms. Biancaria?
Here.
Mrs. Clancy?
Here.
Mr. Foley?
Here.
Ms. McCullough? Mr. Monfredo?
Here.
Ms. Novick?
Here.
And Mayor Petty?
Here. Okay, again, I want to welcome everybody. And before I turn it over to the superintendent for a welcoming, we do have some directions. I think that's going to come up on the screen very shortly. And we have several interpreters and to help out with this. And here we go. Tim is uploading right now. So to hear the meeting in another language, and click at the bottom of the screen. As you can see, there's Chinese, there's Russian, there's Portuguese, and there's Spanish. So is that everybody we have, Sarah? Is that the interpreters?
Mr. Mayor, actually in the language, there's certain languages that people need to click on. So
Right, so they have to click on German, Chinese.
yep,
Russian.
so German is for Albania and then so on. Yep, they can read their languages there. Yep.
Okay, so people, okay. So again, I think the superintendent and her staff has worked pretty hard, and this is going to be a little bit of a moving target as we go forward, but I think it's good to have the parents give them as much information as possible to what we're thinking. Maybe it's going to be subject to change in the future, but Madam Superintendent, you want to say a few words before we turn it over to the presentation?
Yes, thank you, Mr. Mayor. Welcome to our community forum on school reopening. Tonight, we are presenting to you Worcester Public Schools reopening preliminary plans. The chairperson of each committee will be presenting this beginning work. At the conclusion of the presentation, there'll be an opportunity for questions and comments. I want to thank you for joining us tonight. We value your comments, your feedback, and we are very excited to be using, for the first time, Zoom webinar, being on Facebook and YouTube, to continue our constant communication that we want to have with you during the time of planning. So I'd like to now introduce Mr. Allen, who is the Chief Financial Officer for the Public Schools.
Thank you, Superintendent. Mr. Chairman and School Committee. In the first two sections, a district review capacity analysis for both school facilities and student transportation using different social distance and district parameters. The first theory is an overview look at the district's facilities capacity analysis. The Massachusetts School Building Authority and Canon Design Architects developed a tool for the Massachusetts Department of Elementary and Secondary Education to allow school districts to enter certain social distancing and other building parameters to determine the building capacity for students. The tool uses square footage information from the Massachusetts School Building Authority's school reviews from 2016 and last year's student enrollment counts. There are certain limitations with this tool, so the district suggests that this information should be viewed more as an overall capacity guide for the district to determine the appropriate school reopening model, and individual school by school information may be subject to other parameters in each school building that will be discussed briefly in the following slides. So on this slide, some of the parameters that were used by the district in analyzing Worcester's data assumed 3 feet of personal space per student for each student, 3, 4, 5, and 6 foot social distancing of desks in classrooms. And while the district has identified schools with what is called recapture space, spaces such as libraries, cafeterias, auditoriums, and gyms that could be used as additional non-traditional classroom space, The district did not make any assumptions on the use of this space or ability to provide staff for these spaces since the FY21 budget is still unknown. To maximize students in the classroom, the tool looks to maximize the use of space within classrooms. While these models may suggest desks be spaced either in a traditional grid, that's desk through equal rows across the rows, or in isometric placement, desks staggered between rows, each of our schools' individual actual combination and spacing may be different based upon actual furniture in the schools. Throughout the district, there are several schools with varying length tables, box desks and chairs, and tablet armchairs. So while some of the district schools may have similar square footage of schools, may be different capacities based on the style of desk used in each school. Here's an example of desk placement in a classroom using 6-foot social distancing. The classroom pictured here uses box desks. The modeling tool in this example uses a typical 750 square foot classroom using an isometric desk configuration. Again, desks staggered between rows in the illustration on the left, which would show that a total of 7 students as the maximum capacity for this classroom, assuming appropriate needed space for teacher desk and front of room instructional space. Here is an example of desk placement in a classroom using 3-foot social distancing. Again, the classroom pictured here uses box desks. Also, again, the modeling tool in this example uses a typical 750 square foot classroom, but this one is using a quad grid configuration, desk equal rows across, which show a total of 17 students as the capacity for this classroom, assuming appropriate needed space for teacher desks and front of room instructional space. Using this modeling tool for the Worcester schools, when the social distance parameter is set at 6 feet between desks, there are no schools in the district that could accommodate 100% of the students in person at the same time. 11 of the district schools would have between 100 and 200% capacity, meaning that the schools could accommodate no more than 50% of the students in person at one time, while 50% of the students would need to participate in remote learning. This could mean something like a day on, day off model, or week on, week off model, and these hybrid models will be discussed in some level of detail in the next sections. At 6 feet social distance, there would be 28 schools, the majority of our schools in the district, that would have greater than 200% capacity. That would mean that 1/3 of the students would need to attend school, only 1/3 of the students could attend in person at any one time, while 2/3 of the students would need to attend through remote learning. This could mean something like every 3rd day or every 3rd week in person, while the remainder of the time is through remote learning. If the district is applying the same in-person and remote learning model decision based on the overall district capacity in all schools, then using a 6-foot social distancing model, schools would be 33% of the time in person and 67% of the time through remote learning. Next slide. Using this modeling for Worcester schools, when the social distance parameter is set for 3 feet between desks, 25 of the district schools could accommodate 100% of the students in person at the same time. 16 of the district schools would have between 100 and 200% capacity, meaning that schools could accommodate no more than 50% of the students in person at one time, while 50% students would need to participate in remote learning. If this district is applying the same in-person and remote learning model decision based on overall district capacity in all schools, then using a 3-foot social distancing model, schools would be 50% of the time in person and 50% of the time through remote learning. Initial state guidance is for districts to look at social distancing models of between 3 and 6 feet. The previous 2 slides looked at both 3 and 6 feet. At 3 feet, Worcester schools would be 50% of the time in person, while 6 feet social distance between desks would equal 33% of the time in person. Therefore, using these 2 ranges, the district also looked at the models at 4 and 5 feet. Once again, if the district is applying the same in-person and remote learning model based on overall district capacity in schools, then using a 4-foot social distancing model, schools would be 50% of the time in person and 50% of the time through remote learning. While at 5-foot social distancing, since there would be 13 schools greater than 200% capacity, then schools would need to be 33% of the time in person. The state's online tool did not include information for all of the district schools as listed here for a few different reasons. However, generally, the district is using this online tool information systemically to understand general school capacity parameters to inform the 3 options of in-person and remote learning models that is needed to be considered for the state. While these schools were not included in the state online tool, we need to think about all of our schools, including these listed here, more specifically when it comes to social distancing, types of students served, types of desks used, and other in-school activities. That work is ongoing and all schools are included for district planning. The other area of capacity analysis is for student transportation. The district expects that the number of students that will be able to be transported will be reduced significantly under state guidance. So revised transportation capacity must also be considered as the district develops a return to school model. As of today, the district awaits guidance from the state on transportation guidelines. Based on information from last week, we expect the transportation guidance to be released this week. The district is building various transportation scenarios under similar parameters as the classroom examples. In terms of these parameters, the starting point is an understanding of the current ridership in vehicles used for student transportation in Worcester. The district transports about 45% of all students on a daily basis. 11,500 students ride buses daily. The district plans to use 101 large buses. These are the corner-to-corner buses on a daily basis. The district plans to use 74 mid-size buses. These are the curb-to-curb buses on a daily basis. The district plans to use 21 wheelchair buses daily. The district buses are used to route the tier schedule, on average 3 trips in the morning and 3 trips in the afternoon, and the district transports local private, parochial, and charter school students as well. As we look at the various scenarios on the following slides, it's important to note that due to national school bus driver shortages, school bus manufacturing schedules, and fiscal constraints, the district does not have the ability to add many more buses to address capacity limitations. The district must plan on a model that uses the existing planned number of buses. Under normal circumstances, the large buses have 24 bench seats and are assumed to accommodate up to 71 elementary students at 3 students per seat and up to 47 secondary students, 2 students per seat. The mid-size buses have 9 bench seats and can accommodate up to 16 students, and the wheelchair buses have 4 bench seats and can accommodate up to 7 and 3 students using wheelchairs. Using 6-foot social distancing on buses, the large buses that can normally accommodate up to 71 elementary and 47 secondary students, students would be spaced every other row on alternating sides and would be able to accommodate 12 students. That's 17% of the elementary students and 25% of secondary students. The mid-size buses that could normally accommodate up to 16 students would be able to accommodate 4 students, or 25% of normal capacity. And the wheelchair bus that can normally accommodate up to 7 walk-on students would be able to accommodate 1 walk-on student, or about 14% of normal walk-on capacity, and 1 student in a wheelchair, or 33% of capacity. Using the 3-foot social distancing on school buses, again, the large buses that normally can accommodate 71 elementary and up to 47 secondary students, students will be placed 1 student per bench seat and would be able to accommodate 24 students. It's about 33% capacity for elementary students and 50% of secondary students. The mid-sized buses that could normally accommodate up to 16 students would be able to accommodate 8 students, or 50% capacity. And the wheelchair that can normally accommodate up to 7 walk-on students would be able to accommodate 3 walk-on students, or 42% of normal walk-on capacity, and 3 students in wheelchairs. Clearly, Both facility and transportation capacity is an important component of school reopening planning. And now turn the presentation over to Dr. Mary Mead Montague and Dr. Marie Morris to discuss the various back-to-school models for consideration.
Good evening. The first, if you could turn the slide. Thank you. First, we'd like to give you some background due, obviously, as you are aware, to the uncertainty of the status of the COVID-19 virus. The State Department of Education has asked districts to develop 3 reopening plans for schools: a full reentry plan, a hybrid, which is part in school and part remote, and a 100% remote model. On July 2nd, the school committee requested that school administration focus on the development of a hybrid model. Emphasis for this model and the development of this model included that the model would meet social distancing of at least 3 to 6 feet for all school buildings, provide students the most days of direct instruction with teachers as possible, meet the learning needs of the variety of learners in our schools, and also address feedback from the spring remote learning experience. Dr. Morse, I think you're muted.
I apologize, I'm so sorry. When developing our potential models for returning to school this fall, we just considered the multiple perspectives of students, families, and teachers in order to inform our work. While a tremendous effort was given by all, we recognize much work could be done. Common themes and issues arose. We found that students missed their teachers and their friends. And in some cases, students found the remote learning plans to be busy work and not as robust and rigorous or meaningful as the work they received in school. Others felt that they needed more access to technology or to the internet. Also, in addition, families may have struggled with the structure of remote learning and wanted and needed more support and time to juggle family and home and life work with the additional job of supporting remote learning for their students. And teachers also shared that remote learning was challenging and in many ways offered the need for routines and schedules and additional collaboration and needed specific grading policies. And these were some of the needs that were identified as we consider our models moving forward.
2 models that we will address tonight that have been developed. One is the 1-week rotation 50% model, and the other is the 1-week rotation 1/3 model. First, we'll start with the 1-week rotation 50% model. And this model is based on approximately 50% of the students occupying a school building at a time. And as you recall from Mr. Allen's slides, this would be at the 3 to 4 foot distance, social distancing level. With this model, students would engage in 2 days each week in-person learning at their schools, either Mondays and Tuesdays or Wednesdays and Thursdays. And they would engage in remote learning the other 3 days each week, which would be depending on what group you were in. If you were going to school on Monday and Tuesdays, you would be remote for Wednesdays, Thursdays, and Fridays. If you were going to school on Wednesdays and Thursdays, you would be remote for Monday, Tuesdays, and Friday. The 1-week rotation 1/3 model is where we have approximately 1/3 of the students occupying a school building at a time. Students would engage in learning on Mondays with their teacher while at home in a remote learning environment, but there would be direct instruction with their teacher. Then, depending on which group you were in, you would go 1 day per week in-person learning at their schools, either Tuesdays, Wednesdays, or Thursdays. And then there would be remote learning on the other days each week when they were not at school. The 1/3 model would be based on the 6-foot social distancing parameter. So student groups are classified in we have classified students into 3 basic groups based on their level of need for in-person instruction. And this really addresses the need of students to actually to meet the needs of the various learning needs of our students. Group A would be students who are in general education classrooms who do not have any specially designed instruction. Group B students would be those in general education classrooms and those who receive specially designed instruction. Examples of students in Group B would include students who receive specially designed instruction in an inclusionary setting or a pull-out manner. Students who are English language learners, except in the New Citizen Center programs, and English learners in sub-separate programs. Group C students would be students who require the most in-person instructional support to access learning. Examples of students who would be in Group C include students who participate in substantially separate programs, students with disabilities who have significant developmental, emotional, and cognitive needs, whose instructional setting includes supplemental and or modified instructional services. Also included in Group C would be English learner students in the NCC programs and English learners in sub-separate settings. Students in alternative programs such as Challenge and Reach Academy, Gerald Kramer Center, and the alternative program at St. Casimir's. In addition, as we said with the 2 models, because neither model actually has all students in at a time, we've had to put students into cohorts. So in the 50% model, there are 2 cohorts, and in the 1/3 model, there are 3 cohorts, 3 cohorts of students. But cohorts of students will be chosen based on the following criteria. Sibling consistency. And what we mean by that is that families who have students in multiple buildings will go to school be in the same cohort. So they would go to school the same days. And this is in groups in cohorts 1 and 2. And that would mean that would really be students in those families who are in groups 1 and groups A and B. For students in Group C would go to school consistently for all of the days. There would be included in that would be bus ridership, bus routing, high school routines, such as students participating in innovation pathway programs and Worcester Technical High School. And of course, we would always consider hardship considerations where families are doubled up or families are in a situation where they're supporting each other with their children in order to work and other significant issues like that.
Our first back to school model to discuss, we refer to as the 1 week rotation 50% model. And what this means is that student body is divided into 2 cohorts, cohort 1 and cohort 2. Each cohort attends school 2 days per week. So in this particular case, cohort 1 would attend school on Monday, Tuesday. Cohort 2 would attend school on Wednesday, Thursday. On the other or following 3 days, instruction would be fully remote. So on this slide, we see a student in Group A, and as Dr. Meade-Montague referenced, this student does not get specially designed instruction. And you would see that on the left, you would see elementary and middle and high school. So you would see that the live in-school days, students in the elementary school would receive ELA, math, science, and social studies instruction with their teachers. And then in middle and high school, they would have a typical 7-period day. On the box to the right, you would see 3 remote learning days. So if you go to school on Monday and Tuesday, your remote learning would be Wednesday, Thursday, and Friday. Or if you go to school Wednesday, Thursday, your remote learning days are Monday, Tuesday, and Friday. And on our remote learning days in elementary school, students would get art, music, physical education, technology, and health virtually, and also core instruction would be provided through the Google Classroom. The middle and high school students would be provided instruction through the Google Classroom. Could we go to the next slide, please? On this slide, this is again the 1 week rotation 50% model for student group B and student group C. In student group B, you would see again, students would attend school either in cohort 1 of Monday, Tuesday, cohort 2 of Wednesday, Thursday. And in their live in-school days, they, like cohort A, would receive ELA, math, science. But in addition to that, they would be provided with specific ESL instruction, social studies, and special education support. And that same model would be applied to middle and high school. They would follow their 7-period day, but additionally receive the specialized instruction and support that they need. The difference here for these students in the remote learning days would be that they receive art, music, phys ed, health, etc. But in addition to all of that, they will receive specialized ESL instruction, and students with disabilities would also receive their specialized instruction. And in middle and high school, their instruction will be provided through the Google Classroom. Group C is another group of students as described earlier by Dr. Meade-Montague. And our students in Group C would be provided in-person instruction for 4 days and 1 day of remote learning. So students in Group C would attend school on Monday, Tuesday, Wednesday, Thursday, and Friday would be remote learning. On their remote learning day, they would still receive special education support. And on their in-person days, they would expect to receive core instruction, ESL, electives, and specialized special education support. Can we go to the next slide, please? So here is a possible example of what an elementary schedule would look like for the 1 week rotation model. So this is a student who is in cohort 1. So they attend school on Monday and Tuesday. And as you can see, as they go through the day, there is an emphasis on building relationships and core instruction. So you would see specifically designated times for reading, math, science, and social studies. On the remote learning days, Wednesday, Thursday, and Friday, their day will be organized a little bit differently. However, it will be coordinated with their live learning time. So here is an example of an elementary remote learning day. It's just an example, but as you can see, students would log in and go to their Google Classroom, and they would watch a video from their teacher. And the video would describe what the learning for the day would be. It may be instructions, and also there'll be resources available to students. The students will sign in and then begin their academic work, and their academic work spans all of the core content areas, ELA, math, social studies, and science. And in this particular student's day, Their enrichment block is at 10 to 10:40, and they would have either art, gym, music, or technology on these days. We found there is a really important piece to students being successful remotely, so providing a discrete and specific schedule. We would provide a lunch and a break for every student. And for this particular student, they're also going to be given a specific time to work on Lexia, provide time to catch up on and complete academic work assigned earlier in the day. And also in this particular schedule, ST Math would be scheduled at a specific time. Assignments would be posted to the Google Classroom, and there'd be ongoing feedback between the student and the teacher. This is just one example of what a remote learning day could look like for a student. It isn't the only example.
And here is an example of a sample secondary schedule in the 1 week rotation 50% model. So this would be a student in cohort 2, as opposed to in the elementary model, that was a student in cohort 1 who went to school Monday, Tuesdays. This sample schedule shows a student who is going to school on Wednesdays and Thursdays. And when they're in school, and when I say secondary, this is both middle school and high school students when we refer to secondary. They have a 7th period day, and during their 7th period day, when they're in school, they will have all 7 of their classes, and they'll have a break for lunch. A sample schedule in the remote learning days is when they're, for secondary, would be a little altered, where you will see that we again recommend a routine schedule for students so that they can stay on task. But during this time, they would have, on one day, they might have 3 periods, and then on another day, each of them, they will have 2 of their period classes, where during the morning when they log in at 9 o'clock, they would sign on to the Google Classroom, watch a mini lesson video from their teacher, review and complete any posted assignments and tasks. There'll be a break for lunch and really time for them to work on completing tasks. And we also have several learning platforms that they can use to support their learning, such as Khan Academy and Alex and Lexia are also for this group. In this model, the 50% rotation model, what you see is that a total of in-person days for students would be 73, no matter which cohort you were in, and 107 remote learning days for a total of 180 school days. This is a sample calendar for a 1 week rotation 50% model, where the darker color of orange would be a student in cohort 1 and when they would go to school. So you'll see in that darker orange color, you'll see that they're in school on Mondays and Tuesdays throughout the school year. The students in cohort 2 would be the lighter orange, and that would be a student who would attend school on Wednesday, Thursdays, and on Wednesdays and Thursdays each week. And you'll see that the gray are school vacations or non-school days.
This is our second hybrid back to school model, and we refer to this as our 1 week, 1/3 model. What this means is the student body is divided into 3 cohorts. This model also assumes for 6-foot social distancing. On this slide, you'll see an example of a student who is in group A. And in this model, as you can see, there'll be 1 day in-person learning, whether you're in cohort 1, 2, or 3, for the sake of explanation on this slide, Tuesday would be cohort 1, Wednesday would be cohort 2, Thursday would be cohort 3. Each student would have 1 day of direct remote learning, which for all students would be on Monday, and all cohorts and all students would have 3 days of asynchronous remote learning. So if you go to school on Tuesday, your asynchronous remote learning days would be Wednesday, Thursday, Friday. Wednesday is your in-person day. Your remote learning days would be Thursday, Friday, and Monday. And finally, Thursday, if you're cohort 3, your remote learning days would be Tuesday, Wednesday, and Friday. So the classes for students in group A, in-person and synchronous learning would occur, and what students would experience would be similar to the other model, ELA, math, science, and social studies classes in elementary schools. Middle school would have the typical 7-period day, and high schools would also have the 7-period day. The remote learning, they would experience similar to the other model, art, music, PE, technology, health, and core instruction through the Google Classroom. And in middle school, instruction for remote learning would be through the Google Classroom, and also the same would be for high school. We go to the next slide, thanks. The 1-week rotation, 1/3 model for group B students would be similar. 1 day would be synchronous remote learning, which would be Monday for all students. 1 day in person, Tuesday, Wednesday, or Thursday, depending upon which cohort you're in. And 3 days of asynchronous remote learning. And those 3 days are listed on the slide, and they are described as the same from the slide before. Classes for the Group B student would be similar to Group A students. However, the difference here is that students in Group B would receive ESL and special education support on their synchronous day and also their in-person day. And also they would, in their remote days, they'd have art, music, PE, technology, core instruction, and ESL and special education support in their remote learning days. For the middle school student who's a Group B student, they would have a 7-period day, but for their remote learning, they would have the instruction through the Google Classroom, but also has the specialized support as needed. And similar for high school, instruction could be provided through the Google Classroom, and they would also be entitled to ESL, specialized instruction, and special education support. For our Group C students, they would continue to have 4 days of in-school opportunities and 1 day remote learning, and that would be each week. And the classes they would expect to have would be their core classes, ESL, electives, specials, and also their special education support if needed. So here's an example or a sample of an elementary schedule on the 1-week rotation 1/3 model. So as you can see, on Monday, it's called Remote Learning Day, and it would be direct instruction with the teacher, and this would be for all students. This particular student is cohort 1, so they attend school on Tuesday, and this would be a sample schedule of what they would do on Tuesday. And you would see there would be some similarities to the previous model, but they would be expected to engage in their core instruction on their in-person, in-school days. And this particular student attends remote learning on Wednesday, Thursday, and Friday.
The sample secondary schedule is similar to the 1-week rotation 50% model, except the student again would only go to school 1 day during that week and not 2. So this would be a student in a cohort 2 student who would go to school on Wednesday. So again, the remote learning day on Monday would be a day of direct instruction with the teacher, with the teachers in a secondary model, because the student would have more than one teacher. And we would call this synchronous. And the reason why we call it synchronous simply means the same at the same time. So the teacher and student are on at the exact same time. The other days are remote learning days, and we call those asynchronous. And that means that the teacher and the student are not on at the same time. The teacher would record the mini lesson for the student in the instructions for the student and have assignments in the Google Classroom for the student, but the student would then be able to go on in the classroom and accomplish that work at various times during the school day. While we recommend a set schedule, when they're in an asynchronous manner, that is where there's flexibility, where depending on family schedules, where a student might not start at 9 o'clock, for example, might, because of parent schedules, start at 12 o'clock, but it would still go accordingly, where they would have a few of their classes for the secondary, except for the direct instruction day with their teacher. It would always be where they would have less than 7 periods. When it's a direct instruction day with their teachers, because we want them to see all of their teachers, they would have all 7. But during the other remote learning days, there would be either 2 or 3 classes that they would complete assignments for. And finally, this is a schedule of a sample calendar for a 1/3 model. And you'll see to my left a chart that shows the in-person days. Because it is only 1 day per week where the students are in school, it actually will be 37 in-person days, but there'll be 35 in addition direct instruction days. That's where we call that synchronous time, where the student and the teacher would be together, but remote through Google Classroom using Google Hangouts or Zoom. And there would be 108 remote learning days for a total of 180 school days. And next to it on the right, you'll see a calendar, and you will see 3 variations of orange. The lightest one would be cohort 1, and then cohort 2, and then cohort 3. So that you will see that they would go, what Tuesdays they'd go to school, what Wednesdays they'd go to school, what Thursdays, and then you would see the gray, which shows non-school days. So with both school models, with both of our hybrid models, if you could, okay, thank you. With both of our hybrid models, they can easily be converted to 100% remote learning, of a 100% remote learning model if the need arises. The 100% remote learning model would include both direct instruction time with teachers and time for students to work independently. This is something that was very clear from the feedback from teachers, from students, from families, that this is what they value and felt was necessary. Also, we would include other things that really came from the feedback from our stakeholders, and that is that the model would also include daily help sessions with teachers, teachers regularly checking in on student progress, office hours for families so that they can call in and ask questions and get support with their child's learning. And most of all, which we heard loud and clear from everyone, grading of student work. All student work would be graded. I'm going to turn over now to our manager for instructional technology and digital learning.
Good evening. Tim, if you could advance. So we all know how essential access to reliable technology and internet is in supporting learning both in school and at home. Therefore, we have made a commitment to provide a device for every Worcester Public School and Head Start student to ensure that every student has access to the internet for the entire school year. We have also purchased hotspots from Verizon. We are moving to iPads for preschool, Head Start, and kindergarten, and keeping Chromebooks for grades 1 through 12 in transition. We have also purchased Chromebooks for all staff who didn't have access to mobile devices, including all instructional assistants, guidance counselors, and assistant principals. Google Classroom will be the main jumping off point for content delivery for grades 2 to 12, and we are purchasing Seesaw for preschool, Head Start, kindergarten, and grade 1 for a better early childhood experience. In addition, we are continuing with a teacher choice of either Google Meet or Zoom, but knowing that Meet takes up less bandwidth, we are purchasing the enterprise version. We are also keeping Screencastify and adding Screencastify Submit, and we are continuing to purchase Google Voice in addition to several other productivity apps. Through surveys, Through surveys, we learned that we need to increase support to families, so we are partnering with community organizations and creating a family technology academy, which will be offered in a variety of formats and languages. We are also offering more drop-in support through digital drop-ins. Next slide. We learned that educators appreciated the support for technology integration and that staff have different needs and like to learn in different ways. Therefore, we are expanding our technology coaching support from 4 to 8 technology coaches, and will continue to support staff through a variety of modes that they have said work for them, including digital drop-in hours, webinars, blended learning, and self-paced opportunities. Thank you. I'm now going to turn it over to Rob Pizzella, the School Safety Director.
Thank you, Sarah. Good evening, Mayor, members of the school committee, and the community members at large. As you entrust the care and temporary custody of over 25,000 students and 3,000 staff to us, I, as a school safety director, understand the magnitude of the many challenges that lie ahead. I hope starting this evening that we can begin, and I say begin, to allay the many concerns that staff, families, students, and elected officials have about returning to school. We do know that ongoing communication is vital between now and the opening of school, and the many opinions that we will be getting from the community will be taken into major consideration. I'd like to first start to say that Superintendent Benender has designated myself as a safety director and Jim Bedard, facilities director, as what we refer to as COVID-19 response leaders for the district. This position is vital in that every day we cannot deny the fact that once we go return to school in person, that there are going to be issues that we need to deal with as they come up. And so as the COVID-19 everyday response leader, myself and Jim, in each principal designating a person in their building to be a point person on COVID-19 issues as well, we understand that these issues will have to be dealt with very quickly once they arise on a daily basis. As the school committee has requested, and we also know this as a school administration, we want opinions on how families feel about returning to school. So we had set up a few weeks ago a district email address for parents and community members to comment, COVID-19@worcesterschools.net. I will say to you that it is incredible the passionate emails that have come in from people on how they feel about school reopening. And I continue with over 1,000 participants tonight viewing this presentation. I continue to stress to each of you, if you want to comment more thoroughly, then please email us at covid19@worcesterschools.net. One of the things we are doing is that upon any employee of the Worcester Public Schools returning to work, because of personal and work condition safety, we want them to view a school reopening training video. We feel that we want to protect people not only from themselves on COVID-19 issues, but also from others. So this training video is very important and mandatory that they see prior to coming to work. Next slide, please. I think everybody knows by now from what we have read, common sense, that personal protection equipment, also referred to as PPE, is vital to the safety of people. So every school will, prior to coming back, every school will be supplied with ongoing personal protective equipment. The main items are mask, gloves, hand sanitizer, and what we refer to as screen guard stations. I'm sure everybody has walked into a pharmacy or you've walked into a bank where you see these screen guard stations where you are protected from talking to the other person through a guard. These screen guard stations will be strategically placed in each of the schools. And in some cases, we are considering putting them in particular classrooms to protect students from being at risk from one another. In regards to cleaning and disinfectant, that is a major item that will be in our schools, how we're going to clean our schools during the school day and after the school day. And as I put here, the primary person, of course, for cleaning is the custodian in each school building. But we also know that teachers and others are very concerned that they be given some type of cleaning supplies while they're working inside the school building, and they will be accommodated as well, along with other key staff that need cleaning and disinfectant in order to do their job safely. Mr. Allen put this slide. He is the one that is ordering a 12-week supply of personal protective equipment. This is just to give you a sample of what we will be ordering, the amount, the volume that we will be ordering relating to hand sanitizer, gloves, masks, and shields. The number one concern that I have been working in the pandemic, unfortunately, since it started in March. I've served for the superintendent on the city manager's incident command structure. We had a rapid response when the pandemic came at us fast and furious in this community. And throughout from March to today, I have had the unfortunate experience of having to speak with staff in buildings where they thought exposed to a COVID-19 positive person or in the workplace. And in interviewing these people, these workers and staff, I can tell you that it is the amount of emotional concern they have for their own well-being and others is incredible. And so we know that this is going to be the same for a student, a staff member, for a family member knowing that their son or daughter has been sent to school in regards to being exposed and possibly infected to COVID-19. So what we need to do...
No sé si me pueden escuchar, pero está entrecortado. No puedo escuchar nada de lo que está hablando el señor.
So what we need to do is make sure that we put the health and medical assessment of individuals
Entonces vamos a asegurarnos de poner la salud
of our nurses and our school-based health centers. They will be the primary point of contact when there is somebody in a school building that feels they're either exposed, ill, or some other type of illness related to COVID-19. I believe the superintendent recently made a statement, and I'll defer to her for later on, that there will be a nurse in every school. No school will be exempt from having a nurse in your school. The superintendent's committing to putting a nurse in every school. Also, based on the DESE, Department of Elementary and Secondary Education guidelines,
Se va a haber una enfermera en cada escuela.
they are saying to us that we need to have a special room referred to as
También
an
basada en el
isolation room.
Departamento de Educación Elemental y Secundaria.
Whenever a student possibly is ill from symptoms for COVID-19, they need to be taken out of the classroom and brought down to a special room where they can be given care immediately. This isolation room will be in every school, and it will be monitored by, we have yet to determine who that will be, but it'll be monitored by somebody while the process of contacting parents to come take their child home from school that day.
Donde va a tener un cuarto designado para la isolación donde va a estar siendo observado por alguien mientras se contactan los padres del estudiante.
We want everybody to know right now that testing is not mandatory for any Worcester Public School staff or students.
Queremos que todo el mundo sepa ahora que
So we want everyone to know that it is essential that staff, families be responsible for monitoring the health and medical condition of themselves and their children before they come to school. Right now, we will have a variety of ways of checking on the health and safety of children, students in school. But right now, we just wanted, because it's a very popular.
ahora tenemos una variedad de maneras de verificar la salud de los niños.
We will not be taking temperature checks as students
Ações de temperatura não serão realizadas.
of our school buildings. In regards to a student or staff member testing positive, it is incumbent upon a staff member or a family member, if their child or a staff member is positive to COVID-19, that they notify the school district. And that's for a number of reasons. Even though they will be tested by their primary care physician or a healthcare provider, or even through the Department of Public Health, even though that goes into a centralized data system and the Department of Public Health will start a contact tracing process, we will need to know, and DESE also stresses this in their guidelines, we need to know, and I've had the experience, as I said to you a few minutes ago, of needing to notify families as soon as possible that their son or daughter or a staff member might have been exposed to a COVID-19 positive person. But we will eventually know and turn over to the Department of Public Health that they will be the responsible agency for doing contact tracing with our cooperation. And everybody needs to know, in particular staff members and of course families, that we will abide by the HIPAA laws. So as I said a minute ago, this is a partnership. There's never a time come where we need to be in this together, where families, staff, school administration officials, principals, students, we need to be aware of our surroundings. We need to report to one another, you know, the essentials of if you feel you're being exposed to a volatile situation in your school. If parents feel that, you know, something's going on in their school to where they want to address with us related to safety issues, we need that partnership. We need to continue to communicate, and we will continue to communicate with families through ongoing bulletins about things they need to know prior to coming back to schools. As everybody knows, we have a very aggressive social media program, and we will use that accordingly in regards to sending out information between now and the beginning of the school year. It all comes down to vigilance on everybody's part and conveying that to one another. In regards to a family, if a student or a family feels that someone's sick, then we need to have them go home. We need to have them stay home if they are feeling sick to the symptoms of COVID-19, which we will continue to reiterate to families what those symptoms are, as well as staff members. And if they're experiencing any symptoms, then we will tell them, please stay home and contact your primary care physician or healthcare provider. And if a healthcare provider or primary care physician says to a student, family member, or a staff member that we want to see you get tested, during the waiting period, there is a protection. We have a law that protects our staff members. That they can be given paid sick time. In addition to, if they are COVID-19 positive, then they can also receive benefits under this special law. So what I'm trying to emphasize is that if you are exposed, if you are positive, you will receive benefits and you won't need to come to work because of obviously hardship reasons of wanting to provide for your family. And if you want more information on this law, then you can contact the Human Resources Department at this email address, or you can call them by phone. Thank you very much.
Okay. So Sarah, we're going to go to questions now.
Yes.
And And how are we doing with the interpretation? I know we had a couple issues. I know this is our first time doing this, so people be patient with us. And
So I
is
know
everybody back on?
the Albanian interpreter was having some connectivity issues. So Teresa's going to be calling him. Everyone else looks like they're okay.
Okay, so basically what we're going to do is people want to raise their hand on their mobile device, and we're going to try to take questions. So does anybody have any questions? So Maureen, did you want to say anything before we move on? Or?
No, Mayor, I just want to thank everybody for watching the presentation and the presenters. And what I want everyone to realize that this is the preliminary, and this is the opportunity now. If you have any questions or concerns.
Yeah, that's important to note. This is preliminary, so people should know that this is subject to change as we move forward. But we want to get input now. I think it was important that we let the public know and be transparent as possible, and try to work with the community and the teachers and the students and the parents and the families to get this right. So we have 937 people we had over 1,000 at one time in the presentation. So right now, and the presentation was good. So I want to thank everybody for taking the time out to do the presentation. It was a good job. And so we're going to try, people want to raise their hand. We'll try to figure out who wants to ask a question.
So Mayor, we have
Go ahead, Sarah.
76 hands raised and counting. So I'm going to go down. I'll call the person's name. I'll allow them to talk.
Okay.
And if they're speaking in another language, we just need the interpreter is going to type to the panelists the question in English, and then the mayor will read the question out loud, and then we'll answer the question. Okay.
So we've got the same thing. The first one would be what, Francis Lamar? Is that what you have, Sarah?
Francis
Okay.
Lamar, I'm allowing to talk.
Okay, just give us your, as Sarah goes through this, just give us your name and your residence. Go ahead, Francis.
Okay.
Is Fran?
Okay, so there's just a technical glitch. I'm just going to let everyone know. Because some people are using an old version of Zoom, it's going to need to promote this person to a panelist. So I'm going to promote them to a panelist to talk and then put them back as an attendee. Okay?
Okay.
Okay, Francis. Oh, you can talk. I think they might have, did they go away?
That's very cool.
Here we go.
So Sarah, go on to the,
Okay.
Hi.
Oh, she's talking. Okay.
I have several questions. But I'm just gonna ask one of my main concerns. So it's partly dual question, but
So you have examples of 3 feet, 4 feet, 5 feet, and 6 feet differences. I'm curious what why it's not the 6 feet social distancing. I'm assuming because everyone's having masks on, you can go down to the 3. And how does that, I'm curious how that plays, you know, particularly in my classroom, because my kids are in a horseshoe and they all have to face me and be able to see each other. And I only have 6 tables in the classroom, as does most of the teachers in our school. We have, I think they're about 5-foot desks at tables, maybe 6 feet. I know I can get 3 kids to a table. So I'm not sure how that works. And we'll be able to get face masks so we can see facial expressions, which is like 50% of my language is facial expressions and grammar.
okay, Maureen, you want to take that, or someone in your staff do it?
Or I couldn't hear it very clearly, but I think the questions that she was asking about how do we, how do you decide if it's 3 feet or 6 feet, it's seat to seat. And that's how we have to put the desk, so it's seat to seat for the measurement. And then I think she was also asking about face masks that might be necessary for those students that need to see the mouth of the teacher talking so that they're able to understand what's being said. And for our staff, we would be providing that as necessary for any student that needed to have that accommodation.
Okay, thanks, Superintendent. Sarah, our next person.
The next one is Karen Taraska, and just remember to say your name and city of residence when you're unmuted. So I'm unmuting you now. Karen?
We can come.
So you need to
come back. You can come back to her if you want to go on to the next one.
The next one is Jeff Horn. So when I click allow to talk, then you need to unmute yourself. Okay, Jeff Horn.
Yep, actually, this is Karen Horn under Jeff's profile. We're Worcester, and we're aligned to Flag Street and Forest Grove for this coming year. So thank you first for the presentation. I'd like to suggest that we consider in the 50-50 model that the remote learning is Monday, Tuesday, and Thursday, Friday, with Wednesday as really the cleaning day and whatnot. And why I'm suggesting this is I think continuity of experience for the students is really important. So everyone gets 2 days in a row of in-person instruction, 3 days in a row of remote learning, regardless of which cohort you're in. I'm boggled by the Monday, Tuesday, Wednesday, Thursday approach. Creating that broken up experience for the learners.
Okay. Thank you. Anybody have any
So
comments?
I have a load of questions, but I'll stop. So.
I appreciate. Anybody want to comment? We have like 100-something questions. So, Maureen, do you have anybody, or just take that under advisement?
I believe when we did those, we found out that Friday was a day that would be most missed. And so we decided we didn't want those students to miss out on education on Friday. So we looked at the calendar. So that's why we picked Monday, Tuesday, Wednesday, and Thursday.
Okay. Sarah, you want to go to the next person?
Sure, I'm going to try Karen Taraska again. Karen, you're unmuted, or you need to click unmute. I can hear. Karen Taraska. Okay, we'll go to the next one. Japhanie Rude.
Hi, Japhanie Rude from Worcester. I have 2 questions. My first is really a concern in seeing the possibility of social distancing reduced from 6 feet to 3 when 6 feet has been the standard from the CDC. And my second point is a question, will there be a 100% remote option for people who don't want to send their children to in-person learning? Thank you very much for the presentation.
Thank you, Madam Superintendent.
So Jeff, one of the things I wanted to also alert you to is that on the 3-day model, that's based on 50% of all Worcester Public School students coming in 2 days and 50% the other. So depending upon the number of students we have that choose all remote, that number could go down. So that would indeed be 6 feet in between students. So we are shooting for the 6 feet and not 3. I just want to explain that to you. And yes, it is going to be an all remote model for Worcester Public School students.
Okay, Sarah, get the next question.
Christina Butler. Whoops. Christina Butler.
Okay, Sarah.
Hello, this is Christina
Go ahead,
Butler.
Christina.
This is Christina Butler from Worcester. So little to no research exists that young students can effectively learn remotely. And in fact, research exists that young students, even with active involvement from parents, cannot learn remotely. So basically, we're crossing our fingers that these children, like K through 2, won't fall too far behind during these most critical years of their learning and development. And I was wondering why there's no plan for, like, why are you doing one plan for a 5-year-old, 18-year-old, and there's no plans for like these younger learners that actually cannot learn remotely? Thank you.
Madam Superintendent, you want to take that or somebody else?
So, Mayor, do you want to add to that one?
Sure, surely. So that is one of the reasons why we have an A, B, C groups. So different students we would put into different categories in reference to their need for direct instruction. So we even have the preschool students would be considered in that group also. So we are recognizing that there are students who might have a higher degree of need for in-person instruction. And with each model, with the social distancing, we try to address the maximum amount of in-person time that we could give each student with a face-to-face teacher.
Okay. All set there? Sarah, do you want to go to the next question?
Yep, Laura Shrestla.
Hello. I just have a couple of questions about how you guys are going to, for the buses, is there going to be like a cleaning protocol that you guys are going to do after each route? What that's going to be like? Is there going to be supplies given to teachers like masks? Do realize that parents send their kids to school with the flu and the cold. What makes you guys think they're not going to send them to school with COVID? That's going to happen. That's no lie. It's going to happen. As to parametric space, if you're going off of Edward T. Hall's parametric space, typically the 3 to 4 parametric space that he says 4 feet is the distance, but that's if one person is walking by another. The 3-foot hallway space between desks wouldn't work because you have to also consider 2 kids walking by each other, and that would be the 6 feet definition. But then you also have to consider wheelchair parametric space, which is at a different radius. Now, AIA guidelines has the standard wheelchair parametric space, which is incorrect. If you have a kid that has a motorized wheelchair, especially if they lie prone, it's a different radius. So these factors have to be considered when you're doing parametric space. Now, this is what I studied, Ms. Maureen Benendez, from my Master's of Architecture that I was telling you about that I did virtually. And I was telling you, and why you guys didn't ask any of the universities around you what they use for virtual learning, because they've been doing it for years. So you should have asked them what models they use. We use Moodle because it was used with Harvard and MIT. That was how they were able to grade and do statistics. So when I was helping with sensory processing disorders and the built environment, we had to come up with these guidelines, especially parametric space when it deals with kids with autism, because parametric space is the biggest trigger of kids with autism, next to noise, next to sound. These are all important. I worked with Temple Grandin, Dr. Temple Grandin, and with Dr. Dak Kopek about the psychology of how this works in built environments. So I'm surprised this hasn't been considered as well. And the protocols for classrooms and teachers aside, they're gonna need the supplies every day. The cleanings of the buildings have to happen every day. Are you guys gonna be updating the HVAC system, which is gonna need it especially because this is an airborne thing that can live on things. So you'll need that upgrade on the HVAC. This is not just kids learning. This is about the safety protocols overall. And that is, you're gonna have to consider this when the kids are meeting to get picked up and dropped off at the bus. What do? We group them up, we line them up. Parametric space is not gonna work for this. Pick up and drop off is gonna have to be reconsidered. You have to think of recess. Kids are gonna play with each other in groups. They're gonna have no concept of this. They're not gonna understand why they cannot do this. If you have them in a cafeteria learning, realize cafeterias or gyms are not good places because of the acoustical issues with those spaces, noise carry. And sound tends to exacerbate, especially in teenagers and stuff like that, when the chemical imbalance is already going on. It's called white noise, and it can make people agitated, as like fluorescent lights do or halogen lights do. That's why a lot of school recommends full spectrum LED lights, because that irritation can exacerbate kids. So these are things that you need to consider on top of all of these other things. And COVID is shining a light on all of these things that I've been giving presentations on for years about this. So look at the models of how we design spaces for people with autism, with PTSD, with Alzheimer's, and how we do that. Those safety guidelines, those protocols, those practices, because they are the kings of exteroceptive, which are your 5 senses, and your interoceptive, which are your internal senses, your fight, flight, or fright. So those you're going to have to figure out how this is going to affect this. And it's going to need to consider, when they go back to school, the aspect of trauma design, because this health crisis did create trauma. And you're going to have to figure out how you guys are going to do this. Now, this is not the fault of the teachers. This is not the fault of you guys. You guys didn't know, but now we know, and now we're in this mess. So trying to come up with ways of doing this is going to be difficult. And the students are going to be frustrated with it, and because the teachers don't know how to use these computer models, but it's not their fault. They've never had to do it before. But I would really consider you guys asking universities, what do you guys use? What do you guys for virtual learning? It's very important that you ask them, because they can probably tell you, and you guys won't be wasting money on things that won't work. And also let the teachers have some control of what apps work best. Zoom tends to work good because you have breakout rooms. You can't do that with Google. You can do just the groups together. You can get more statistical things on Blackboard. I know a lot of schools use Blackboard. So it's all of these kind of things that you guys might have to consider. And Maureen, I'll be happy to email you later on if you want, and talk to you a little bit more about this, if it will help, because this is what I did for 3 years, was talk to people and get them. And I can also show you a chart of what parametric space means if you guys really need to have an image of it. And it's based off of Edward T. Hall's parametrics, which he wrote an article about in anthropology. So it won't be a problem. I'd be happy to help.
Great.
Mary, you're muted.
Thank you very much.
No problem. You're still muted, Mare.
Okay, how am I doing now? Can you hear me?
Yes, we can hear you.
Okay, I know why I was muted, but anyways, thank you for the comments. Brian, do you want to address anything with the transportation or the clumsiness? And I know transportation, we're not there yet. We haven't ever got guidance from the state, but or the spacing.
Yeah, so, Mr. Chairman, with regards to, I think the very first question was with regards to the cleaning of buses. The intent is to have all the high-touch services cleaned between individual trips. And then during the midday, and after the end of the day, they will be thoroughly disinfected through units that we have for disinfecting the buses. So they'll be cleaned throughout trips, midday, and at the end of the day.
Okay. Anything else, Madam Superintendent?
Yes, I think maybe Sarah could talk about all the learning platforms that we could provide.
Sure. So, you know, adult learning is a lot different from childhood learning. So something like Moodle is not appropriate for even some of our middle school students. So we really try to go with age appropriate tools that our teachers are familiar with, that we can really ramp up and scale. So we're pretty confident in our decision to stick with the Google Classroom for the 2 through 12, and then Seesaw for pre-K to 1. But thank you for your suggestions. And I do know that our early college students who are taking dual enrollment classes are using things like Blackboard or Canvas or whatever their opportunities are have. But as we continue to expand, we will continue to look at different learning management systems as we go.
Okay. If you want to send an email, it'd be great. I think Maureen would take that and try to respond to it. But okay, next question, sir.
Yes. So we have Scarlett Shell. And please state your city of residence as well.
Hi, can you hear me?
Yes, we can.
Okay. Scarlett Shell, Worcester. My question was about why you made the decision to not check student temperatures in the morning when they arrive at school.
I can answer that, Mayor. What the superintendent has done recently is that she put together a coalition of medical people and healthcare providers, physician consultant Dr. Bev Nazarian, along with other doctors, pediatricians from the area, in addition to UMass. And they were of the belief that taking temperature, number one, coming through a school building on any given day with hundreds and thousands of students would adversely slow up the process of going, to class many, many minutes. So what we have determined and what we were consulted on was that we need to, number one, make sure monitor checks are going on before they enter the school building. Two, if they were entering a classroom, then the teacher in some capacity might be help us, determine if a student is sick or possibly sick, and if they are, immediately go down to the nurse's office. And lastly, our COVID-19 person we're putting in each school building will be responsible for basically going throughout each and every classroom to make sure that that no child is showing any kinds of symptoms that could be related to COVID-19.
I just add that the guidance from DESC has no temperature taking. So we're following the guidance that we're getting from Department of Elementary and Secondary Ed, and receiving guidance from pediatricians and medical experts.
Okay. Sarah, do you have another
The
question?
next one is just named Norma. Norma? You need to unmute yourself. Okay, they don't seem to be.
Okay, go on to the next one.
Yep. The next one is Victoria.
Hello, can you hear me?
Yes.
Yes.
I am a Worcester resident. My son is going into kindergarten at Flag Street School next year, and we would like him.
Victoria, I'm sorry to interrupt. Could you just state your full name as well?
Oh, yes, Victoria DeMassa.
Thank you.
And I said I'm a Worcester resident. My son's going into kindergarten at Flag Street next year, and while we want him to have the social aspect, the in-person instruction, we don't want him on an iPad all day long, 3 other days or 4 other days as the case may be. And so I'm asking, what provisions are you making for, kindergartners who don't need all that screen time?
Madam Superintendent?
Yeah, so I'm going to refer to Dr. Morse on the kindergarten.
Hi, so we agree with you. We would like to reduce the amount of screen time for our youngest students. We have a lot to work out with a lot of our teachers, but we are looking at Go kits, materials we'll be sending home with kids, activities of that nature. We understand that parents are very concerned about too much screen time, and we are also. So there'll be more to come on that, but your concern is also ours.
Okay. Sarah, the next question.
The next one is Kwame Marshall.
Hello.
Hello. We can
All
hear
right,
you.
yeah, can you guys hear me?
Yeah, please state your full name and city of residence.
My name is Kwame Ture Marshall. I live in Worcester, Massachusetts. I am a resident of Worcester, obviously, and my son goes to the University Park campus. I'm also a youth services coordinator in Plumley Village, so I have numerous interests here. And I'm just curious to know as to how you guys came to a conclusion that, you know, COVID-19 testing wasn't required for reopening the school, because I seem to believe that it seems a little naive to think that you know, Black and Latino communities aren't at risk more severely, you know, for the spread of this virus, and it seems to be a little naive to think that the students aren't going to be passing the virus possibly back and forth to each other. And do you guys have any plans for, you know, what if a child is traumatized from going to school and maybe giving a parent COVID-19? What are your plans from there?
Madam Superintendent?
So again, we have to follow the guidance that we get from the Department of Elementary Secondary Ed, and they are not saying that we test our staff or test students prior to entering school. What they do suggest is that parents take a temperature of their children. If the child has a fever and is not feeling well, that the child stays home. So on the guidance that's provided to us at this point in time.
But that only assumes that things aren't asymptomatic.
I believe that from what we've got from the guidance, who are getting it from a group called Adrian Labs, who are consulting schools all over the world. That's the guidance that is being recommended and that we're going to be following at this point.
And as I was saying in my presentation, that the only thing we can do is to pay attention of symptoms of children in school in addition to staff. And if we do find out that someone has tested positive, it is our responsibility to immediately notify family members or staff members that they've been exposed to a COVID-19 positive patient. From there, they must go to a family care provider and consult with them on symptoms and if they're going to be tested. And then if they are tested, they can self-quarantine. It's in the DESE guidelines that they can self-quarantine. If they feel uncertain about coming back to school up to 14 days, which is why remote learning is going to be very, very beneficial in a number of ways for those who have to stay home because of illness. So we only can do what we cannot mandate. We have to be able to do everything else to make sure that if there's an exposure, possible exposure, then they have to take the appropriate measures by seeking advice, guidance, and direction.
Okay. Sarah?
Okay. The next one is Anna Davies.
Okay, I am Anna Davies. I live in Worcester. My child is a senior at Burncoat and is a part of the early college program. So I have two concerns. One is teenagers have been shown throughout the country and throughout this pandemic to not be social distancing regardless of the guidelines. So how are we in the high schools, in the middle schools, going to make it with these students moving from classroom to classroom? How are we going to maintain social distancing? And two, the early college programs and all of that information has yet to be have any guidance on that. So what is that guidance going forward for this school year.
Madam Superintendent?
So that's Dr. Mary Montague to talk about what our work has been with the early college students and what's going on with colleges.
Yes, with the early college program, we still plan to have a rigorous early college program. Students should be signing up for classes now. We've had the spring, since spring, we've had all the classes that are going to be taught at QCC and also at Worcester State. The QCC has made a determination that all of their classes will be online. Worcester State will, for early college, that decision will be made at the 1st of August. But students have and can still actually register for classes. And we would advise, because many of them are filling, so we would advise for your child to sign up as soon as possible. They can go to the website and actually sign up or contact their guidance counselor.
Okay, Sarah?
Yep.
Go ahead.
David, it just says David. I'm gonna promote them to a panelist because I have an old version of Zoom. So David, you can.
Hi, David Little, Worcester. Can you hear me?
Yes.
Yep.
We can, David.
Okay,
Did you say David Little?
David Little from Worcester, yes. So one of my main concerns is we all know that the COVID-19 is an airborne virus that everybody keeps catching. All right. The one thing that we're not also talking about is what about the children that are carriers that's not showing any symptoms and that can possibly turn around and spread it through the other children in the classroom. I didn't hear no regards to that factor or any sort of airborne filtration system whatsoever. So if there's a child that comes into the classroom who's a carrier, who's turning around, breathing the same air as the rest of the children, so instead of not only having one child being sick, now we have the whole classroom being sick. How do we turn around and conquer that?
So I can answer that. That's why we're using masks and social distancing. And because you're not going to be able to tell who is asymptomatic, right? So that's why we have the rules that students will be assigned certain seats, that we have special rules for going to the bathrooms. Students will be in their chairs with 6 feet between their classmates themselves and their teacher. And we'll have hand washing solutions at the entranceway to all the bathrooms. So the only way I can answer that is that since you don't know who has the virus and who doesn't, unless you're sick in front of you, is that we have to follow the guidelines, especially just wearing masks and hand washing.
Okay, Sarah?
Next one is it's just Jacopo, Jacopo.
Hello, everybody. Jacopo Schiavo from Worcester. My question is in regard to the remote learning, and I wanted to ask a clarification. So, especially for parents who work at full time and probably cannot stay with their kids, especially if they're pretty young, from 8:30 to 2. Did I understand right that as long as the parents, the students submit the assignments, the work can be done at any time during the day? Did I understand right?
Mary Montague, or Superintendent?
Surely. So depending on the group of student your child is in, that is correct. So while we recommend a set schedule, it definitely can be that schedule can be altered. The only time that would need to work out if your to be what we call synchronous, or that time at the same time, is if we had a student who, if your child or any student needed specially designed instruction, then we would need to coordinate those services at a time when both you and the teacher could go on together, or your child and the teacher could go on together. In addition to that, with the 1/3 model, the 1 week rotation 1/3 model, there is that Monday does require what we're calling the synchronous or the same time with their teacher. So that is definitely another time, if we went with that model, where there would need to be that time, the student's schedule and the teacher's schedule would need to be in sync. But the other remote days, they would not have to be in sync with each other, because there would be time for students to use, to look at the video, to look at the videos at the time which works well for families, and to do the assigned work.
Okay, thank you. Sarah?
Yep, the next one is Jill.
Hi, Jill Pearl. I'm from Worcester. I have children both at Worcester Tech and potentially Burncoat Middle, waiting for the letter. My question is, we also have that 6-day rule for children that are sick. So we know that COVID is generally 14+ days. Going on to the next grade, is they going to be adversely affected if one of them gets COVID and cannot attend even remotely because they are so sick?
Madam Superintendent?
So I would not say that we would penalize students for getting sick with the COVID. We've had, before COVID, students that need home instruction and are able to get the help they need while they're sick. So I would say that would be something that we would also implement. Not probably the person inside the home model, but a model that would help the child to catch up on it.
Okay. Sarah?
Eliana Stanislawski.
Hello, can you hear me?
Yes.
Yes, we can.
Wonderful, thank you so much. My name's Eliana Stanislawski. I live in Worcester. I work at the Worcester Adult Learning Center, and I'm a community advocate for the Worcester Refugee Assistance Project. I had one comment and one question. My first comment was, I'm incredibly concerned about how we're basing our responses off of the parent survey. As somebody who did a lot of outreach into the immigrant and refugee community regarding the survey, I mean, most of them couldn't even understand the translations. They weren't able to respond. The number of white respondents as compared to the ratio of white students in our district is incredibly concerning to me. And that, for me, is especially relevant in the conversations around grading. I would really caution you guys, when you discuss grading, to think about the ways that grading is going to penalize students who don't have the same level of access. My question is this: what are your plans to improve your lack of communication with parents, particularly immigrant and refugee parents, who receive little to no communication with interpreters? So most of the families I talked to, if their teachers called them at all, they never used interpreters. The family basically didn't understand anything. A lot of these families aren't literate in any language, and so they aren't able to understand the resources that were sent to their houses. And they aren't technologically literate, and their children aren't either. So most of the families I know didn't turn in a single thing because they had no understanding of this online system. And that is widespread throughout a plethora of communities in the city. And I'd like to know, based on how the rollout went in the spring, how you're going to address communicating with these families who aren't well-versed in technology and aren't receiving translations in their languages, written or otherwise.
So, Lania, we do provide translation and languages. We have the language line, and all parents all teachers were trained on the language line and use the language line to reach out to all the languages. Additionally, our L department personally called we have 8,000 L's, and they called every single one of them and explained everything that was happening. So I'm surprised to hear you saying that. As far as the survey goes, we did connect with Essentia and ask them to contact the refugees in oral language so they could do the survey with them online. I'm just going to ask Carmen Melendez, who's our L director, to also tell you all the other things that were done for our L families.
All right, I need
Carmen?
Carmen and make her a panelist, so just give me 1 minute. Okay, Carmen, you can talk.
Hi, everybody, can you hear me?
Yes.
Yes, you
Okay,
can.
great. So we have interpreter services and translations that we've made available. We've called, like the superintendent said, we called at the beginning of the shutdown all of our L families. There were a group of families whose contact information was incorrect, so those individuals we weren't able to contact, but everyone that had a good number, we called and discussed with the family what the plans were around remote learning. We also assessed their needs and surveyed their questions, and we shared that information to the various departments according to their needs and questions. We're always willing to learn about more opportunities around and ideas around how we could reach out to all of our families. So what we did this summer, we sent an invitation to various community organizations that we have partnered in the past that work with immigrant families, and we offered info sessions through the shutdown to update them on things like the remote learning, the survey that we sent out, the technology needs, so they could then in turn work with their families and share the information with their families. Around the recent survey that we had, like the superintendent said, we actually, I had, in addition to sharing the survey in different languages, we also made videos in our top 7 languages, understanding that not all of our families may be literate in their own language. In those videos, we provided information orally on how they could get assistance in filling out the survey. We also established 2 helplines in our office, one in Spanish and one line that would support the other languages using the language line to help families fill out the survey we would fill out the survey on behalf of a family through the phone call conversation. So those were things that we've been continuing to add more tools and more resources that will allow us to have that communication with the families. And of course, we really need the help and the support of the community to help us continue sharing the information. And we always welcome feedback around what else can we do to ensure that all of our families feel informed and connected with the work that we're doing. Some of the things that we're currently working for our families is that we're in collaboration with the technology department and with Sarah's iTech coaches. We're developing some webinars, live webinars that would support and inform families around things like technology, how to navigate our website, how to create a Gmail if they don't have one. And really, this summer, I really wanted an opportunity to have a face-to-face and a two-way communication with our families. Up to this point, we have been just sharing information with our families, but for me, it was important to have this opportunity to have a two-way communication and really have families ask questions and really be part of a more collaborative effort. So we're working on those. Once those are confirmed with the dates and the presenter, we'll be sharing those in the different languages out to the community. In addition to that, we're also working on different topics more connected to academic and things that families could do at home to support their children, regardless of the language that they speak, support their children with their learning.
Okay, thank you, Carmen. And I think we've done a pretty good job. I think the previous lady who spoke, maybe we can try to work with her. Or we can't lose anybody here. And we probably are losing kids, and not because we're not trying out, but we just have to keep on top of that to make sure we connect, and we continue to connect as much as possible to the immigrant group and the L students. Okay, Sarah.
Okay, Aaron Cole.
Hello, can you hear me?
Yes.
Yes, you can.
Hi, this is Catherine Cole. I live in Worcester. My question is if there will be an option for the in-person direct learning days to be either recorded or live streamed so that kids who have to be home, either from being sick or quarantined, don't miss out on the direct instruction day.
So no, we're not going to be doing that. There are several reasons why we're not. The first is that other people watching really can't see other children and not theirs learning. And so because of that, we're not going to do that. So we'll be doing the remote or the hybrid for students.
Okay, thank you.
Okay, Sarah.
The next one is Jenna.
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 You can come back to Jenna, I guess.
Yep. So the next one is Delia. Delia.
Hi, can you hear me?
Yes, we can hear you. Please state your full name and city of residence.
Hi, Delia O'Connor, resident Worcester, Massachusetts. I have 2 children in the system, Forest Grove and Gates Lane. My question is related specifically to IEPs and how you're going to manage those for children. My younger son, who is on the autism spectrum, has had regressed tremendously because the online learning environment is just not ideal for him. I've engaged in several conversations with the SPED director and the principal, at the school, and while I'm speaking about my son's situation specifically, I know that there are probably a lot of other parents and families who are in the same boat, where our kids need to have their IEPs reviewed to determine whether or not additional services are needed based on how they're regressing, if there is any regression. And unfortunately, there's a certain amount of data that needs to be gathered in person, and with potentially only having 40 to 50 in-person school days during the course of the year, how can we make sure that these kids are getting what they need through their IEPs, that they're getting the right attention when there's not going to be enough in-person time for them, and teachers and administrators to be able to evaluate their behavior, and will any consideration be given to taking support from outside sources, outside ABAs or outside OTs, to support potential regression that's being seen in students in the online learning environment in order to make additional accommodations.
Maureen, you want to take that?
Yes. So what I want to share is that student, it sounds like your child would be a student that would be in Group C. And so for Group C, the plan is that they would receive instruction 4 days a week, every single week. So the only thing that change that is if we get transportation guidelines that may have us have to alter the number of days. But right now, for a child that, like your child, as you described, they would receive 4 days a week. So they would not be receiving the number of days they would be receiving more days than either Group A or Group B.
The next one is William Gates.
William?
Hello?
Yes, go ahead.
Hi, good evening. I just wanted to say thank you for your diligence and
Say your full name and in your place of residence, please.
yes, ma'am. My name is William Gates. My place of residence is Worcester, and I have 3 children in the public school system. And I just wanted to thank you for your diligence and the effort that you went through to prepare the model for students returning to school. But as a parent, I have such a strong concern about the safety and the sort of wisdom of that. So many school systems across the country, including local higher education systems like Harvard and WEA, are canceling all in-person classes. You have recently, like San Francisco school system, Los Angeles school system, all public school systems are being canceled and having remote learning in place. And I've been following the science on this a lot, and like the WHO and the CDC, in response to several hundred epidemiologists, a petition that they drafted saying that have been studying COVID, saying that it's airborne, and the guidelines that the CDC and the WHO had been putting forward were that this radius of 3 feet or 6 feet personal distance doesn't take into account the fact that it is airborne. So you have virus and transmission taking place with virus, and virus will linger in the air for hours. And I think it's upwards of 90% of COVID transmission happens through asymptomatic transmission. So you'll have students coming to school and interacting with other students. And one of the doctors had said earlier that remote learning is challenging. And it is challenging. I had 3 children. I'm a single father. I have 3 children that I'm helping through school, 1 in high school, 1 entering 4th grade, 1 a senior in high school, and 1 entering 8th grade. And it is very challenging. But I submit to you that what's vastly more challenging is a child living their life without their parent, because we're rushing this. There's so much research that has yet to be done. And it seems extraordinarily unwise to push forward in-person. And I'm so sympathetic to the students and the students that need the attention every day. But I don't know if you're familiar with, there's another model of opening schools, which I think is probably worthwhile to research. It's called the SCOL. It's the Safe Centers for Online Learning, in which all schools are opened. I'll say it again, it's the SCOL model. And you turn all schools into safe centers for online learning. So any student that needs special services or is not able to participate in online learning at home can go to schools and participate and get their education at the schools that they need. But those students that are, or parents that feel like it's unwise to do this, to send your children back to school, even 1 or 2 days a week, it's just those students can stay home. So yeah, it's challenging to have remote learning, and please don't take anything I'm saying like with any lack of respect, because I deeply respect all the effort that you've put forward into drafting these plans. It's an impressive amount of creativity and work and thinking about the layouts. But I feel like it's unwise to move forward in this. And I guess I have a combination of like questions and comments. Like I don't have a sense of the calculus that went into what happens when 1 student dies, or what happened when 5 students die, or what happens when 3 teachers die, and what happens when a lot of the computer models are saying that in September, the computer modeling is predicting the 2nd wave in September. And I think our lack of a cohesive and coherent and caring and wise federal response to this has placed an undue burden on a lot of the states. And this sort of fragmented response is I don't want to lay my children at the altar of economic recovery. You understand? I don't want my... Sorry?
We understand. No, I'm saying we understand completely.
Yeah, my children are not going to be sacrificial lambs to a model for economic recovery when the appropriate means to squash this have been squandered, and it's unwise and irresponsible to move forward with this. And I say this having my a teaching certificate in higher education that I got from the Derek Box Center at Harvard. I have a master's degree in architecture. I've taught over 120 college courses in architecture and design. So I'm saying this as a concerned parent. I'm saying this as a professional. I'm saying this as someone that's been reading about this for hours every day in scientific journals, in newspaper articles that have high journalistic standards. I find it extraordinarily unwise to move forward in this. So you showed a lot of numbers about distancing, and let me see the numbers on when you change plans based on how many children have died. Do you have those numbers? Because that's the numbers that you need to look at before you figure out a floor plan for a classroom. And those numbers can be found out. So I've had Duke University contact me to help them draft the epidemiologists at Duke University have contacted me to help them draft a response to COVID. And I've been helping them, but it's like the first question you have to ask is, and I don't even know if it can be answered. I don't even know if it can be answered because the science, there's so many questions lingering with the science. How many students not only will get infected, how many students will die, how many students will suffer permanent brain damage from this, how many students will suffer permanent cardiac heart damage from this, how many students will suffer lung damage from this, how many students will suffer neurological damage. There's so many unanswered questions. It's the saying, like, fools rush in where wiser men fear to tread. You know, I strongly encourage you to
okay. Thank you.
Anyway, thank you so much. I'm in praise of all of you for your efforts and the extraordinary challenges that you're facing so bravely. So I applaud you for that. Thank you so much. Thank you.
And I just want to say what you said is not lost on the school committee as mayor of the city, as superintendent of schools. And we have this internal discussion probably every day, the superintendent. The safety is our number one concern of both the students and the families and the teachers. And so this is a moving target. We're going to be addressed the best based on state guidelines right now. And we're requiring us to come up with 3 plans. And but it's not lost on what you're saying to the school committee. So anybody else want to say anything to that or answer any questions?
Madam Mayor, I just wanted to say that we do hear, the voice, the same as Mr. Gates has other parents have shared that. And that's why we are offering a hybrid model for those parents that, send their children to school and realize how important it is for their child to have the in-person work. But we're also offering remote. So any parent that does not want to send their child to school will get a great full remote program.
Okay. Sarah, next question.
Next is Kate Dukowski.
Kate?
Hi, I'm Kate Stukowski from Worcester. I wanted to know if the district is working on a plan for special needs students that are in Group C who won't tolerate the use of a face mask or shield and that also require hand-over-hand assistance for learning. And due to their disabilities, they can't participate in remote learning.
Madam Superintendent?
Great. We have ordered masks and shields for our special ed teachers, as well as gowns. So for those students that do require that close contact, we have rented, equipment, ordered equipment to protect our staff. So we're well aware. We actually have some students right now that are going to not our summer school, but day school, summer school, and are unable to wear masks on the bus because of the sensory feelings on the child's face. And we're still transporting that student and making those accommodations.
Okay.
Yep.
Sarah?
Jason Carby.
Jason?
Hello, can you hear me?
Yeah, go ahead, Jason.
Yeah, Jason Carby, Worcester resident. My son is supposed to start at Worcester Arts Academy in kindergarten. Actually, the two speakers before basically said everything that we were saying, so I really appreciate your time. It wasn't clear from the presentation that you could opt as a family to stay home and still get educated. So I think, Maureen, you answered that clearly. So now that we know that that's an option, that I think makes a lot of people feel better about things, because we're worried we're going to lose our place in line in school, et cetera, if we're not comfortable with it. But wasn't 100% clear to me is, if you do go to school, are your students required to wear masks at all times? And it is an airborne virus, so if you go to the cafeteria, how do you control the viral load in the air or any kind of filtration? That kind of scenario, you go to the cafeteria and eat, take your mask off, and just defeat the whole purpose of wearing your mask the whole day. So those types of things just make us want to, stay at home. But I'm curious, you're going to have strict guidelines. What are the guidelines for when your students are in school? Are you doing anything for filtration if at all possible? Thank you.
Madam Superintendent?
The
Madam
guidelines
Superintendent?
that right now, kindergarten and first grade do not have to wear masks in school, but they do have to wear masks if they're on the bus. Every other student has to wear a mask, and also adults. For those children, though, that are special needs or, may have a doctor's note or health problems, they do not have to wear masks in school. We will still have the 6 feet in between students. And you are right, for the cafeteria part, whether it's in the cafeteria or more likely in the classroom, the guidelines do say just 6 feet in the classroom while eating. Because the masks could be bothersome to students, the guidelines also say that we have to give frequent mask breaks, and those have to be done outside, and students have to be 6 feet apart.
Okay, next one is Ritu Ria Akil.
Hello, can you hear me?
Yes.
Hi, my name is Shilpa Kharka is my full name. I have 3 kids who were in kindergarten last year, and this year they are going to first grade. They go to Jacob Hyatt. And before, I'm talking as a parent, I'm not talking as an expert, so I'm just giving my experience first, how it felt to do the online learning with them, and then, then I have a question, So the 3 months of remote learning I did with 3 of my kids who are triplets. They are 5 years old. Was extremely difficult for me and extremely ineffective for them because they were totally distracted. They were extremely bored. The teachers were saying they were doing what they could, but it is very, very difficult to keep the children in front of computer for so long. No matter how interesting it might be, they are not interested in learning. They are not interested in sitting. So what they could have done in 3 months at school, we couldn't accomplish anything. That's what I think. They could have done so much if they were back in school. And it was kind of expensive for us too. We had to buy like cameras for Zoom and, we had to set up 3 kids. So somebody had to be there all the time. We had to leave office and come here and stay with them. That, of course, they're going to doze off in the middle of the class. They were not interested. They were not interested to study us because we're not teachers and we're not influential enough for them. They don't believe us like they believe their teachers and stuff like that. So my experience is, it may work really well for middle school, high school students, but for little children, I really thought it was really bad. From my experience, I'm saying, the teachers were great. They did what they could, but it didn't work for them, That's what I think. I did what I could, and they did what teachers, but it still was not good. And on top of it, we had to buy like it was like, we learning. We were more of a teacher than teachers could be because of the circumstances. Not that they were not trying not to be, but because of the situation. So I was really expecting, I'm one of those. parents who was expecting, at least we were giving in person, all 5 days in class option 2. I don't know why it was not considered in Worcester, because I have like family in Virginia, and they were saying, they were giving 2 options. Either they could do the remote learning or come to class, but they could only choose one. But we just have to do like 2 days of class or 3 days of class, and then we have to do like remote learning, which I know is going to be very, very difficult for us with 3-5-year-olds. It's not going to be effective. I don't think how much justice I can do to their learning, and I don't know. And they're going to camps, they're wearing masks, they seem to be comfortable, and I was just wondering, why was it not even considered?
Great. Well, thank you for sharing that. I can imagine with 3 children, all the same age, and you coming back and forth from work and doing remote learning, that it was a challenge. It would be a challenge for anybody. The reason why it's not considered is that we cannot, with the size of our buildings and the size of our rooms, we cannot bring everybody back so that everybody has equal learning 5 days a week. So that's why we're unable to offer that at all. And we went to the next best thing, which is the hybrid.
Okay, thank you, Maureen. Sarah?
Yes, the next one is Jillian D. Bonventura. Jillian?
Go ahead, Joey. I think we can see you. Oh, we almost saw you there.
Hello, Mayor. Hello, Superintendent Benenda. It's nice to see you. Thank you very much for your presentation. My husband and I both watched very carefully. My question, I actually have several, but my first question is, who developed this plan to return to the Worcester Public Schools? As a parent of a child who's entering South High School and also as a teacher in your system, I was out there and I wasn't contacted, and I think the voice of the parent and the teacher, not just a survey, which was 2 days ago, really needed to be heard. While the plan is very well presented and it's very well thought out, it's extremely concerning to me in many aspects. There are things like, who will be responsible for remote learning? When teachers are teaching in classes, we can't do both of these things. Following Mr. Gates's eloquent speech, my concern is with your full-time days. Length of exposure, the science is clear. It takes a long time to be exposed to catch this virus. We can't even go to movies that are 2 hours long, and yet we're expecting kids and teachers and building staff to be in school buildings for 7-8 hours a day. So we can start there.
Okay, so Jillian, I can answer that question. So that was developed by the district staff and needed to be done that way because we were looking at square footage and also the guidance and scheduling. The next step is to go deeper into this. So we have all principals have recommended teachers in their buildings, also parents that are on the school council, and they gave us on Friday, and also themselves if they were interested in now joining the committee to go deeper into what does that mean exactly. What does remote learning look like? Who is going to be doing remote? Who's going to be doing person to person? Is the same person going to be doing that? 5-day lesson plan. So this is the structure that we had to do. Looking at all the things that we had to look at, and now going forward, it's the time where there'll be community input, teacher input, parent input, and also we have some students that have been recommended in the high school and middle school input. As far as the length of the day, as of right now, the commissioner has not changed time on learning. So we have to be very cognizant that we are still being held at this point to time on learning. you have any other questions?
While I understand that we're being held to time on learning, the science is clear about exposure, and this is a virus that is airborne, that can be carried asymptomatically by any person. Any person is a vector, children, teenagers, whomever. And this is very, very concerning. Also, I'm wondering about groupings, Group A, Group B, and Group C for my IEP and 504 students. If they're supposed to be inclusion students, how does them being separated into homogeneous groupings make this equitable?
So that then would put your child in Group B, not Group C. So Group C are for self-contained special ed students that have inclusion. 504s would be in Group B.
Okay. Sarah?
Yes. 1 second. The next one is Melinda Martin, and she needs to be promoted to a panelist. Melinda.
Yep, I'm here. I live in Worcester. I also work for the city of Worcester. I have a bunch of questions from other staff, so I apologize that I'm going to be long-winded. My first question, if you're having these meetings via Zoom, what makes you think opening the schools is safe? Who's remote teaching while teachers are also teaching in person? Are teachers now going to get a double salary? You're expecting them to do 2 jobs. How about teachers that want to remote teach only? Are teachers going to be given that choice? If students are given a choice to both remote learn, are teachers going to be given a choice? I'm immunocompromised in 2 ways. I'm a single mother of an 8-year-old girl. I am scared to death to go back into that building with absolutely no testing being done. Absolutely no testing and asymptomatic people left and right. Hang on, I have several other questions because it seemed that no educators were getting on.
Well, we spoke to the. Maureen, you're going to have a special meeting for teachers too in the future, so.
Hang on, I do. And I also signed up to be on that committee, so I hope that I am called because I know that my principal did say my name was forwarded. Hold on, I have some other questions from another teacher. Also, are prep periods, what's going to happen with prep periods? We had to file a grievance at our school last year because prep periods were not being handled. How will subs be provided? What will Fridays look like, teachers? Are teachers going to get paid extra for teaching 2 different ways? I think that's one person.
Melinda, do you want me to start answering some of these?
Sure.
Okay, no, they're not going to get paid double. Teachers are going to, be doing their 5 days of instruction. Some may be remote and some may be direct, but you will be doing 5 days of instruction and 5 days of lesson planning. As far as, did you say that you were at Sullivan, right? That's what you said?
I did not mention the school I was at.
Oh, okay.
I don't think that was required.
Are you at a middle school?
I am not.
So high schools and middle schools, because they're going to be having the 7-period day, we still have their planning time because, as you know, in the contract, you can only teach 5 and you have 2 periods a day. So there's not going to be any challenge on that. And for elementary teachers, that's Friday. They would get their 4 on Friday.
Okay. And this is sort of a work in progress too. Maureen, are you going to have special meeting with the teachers too?
Well, we have teachers on each group, and I'll be continue to send out emails and informing them of the plans going forward from now. Also, we still have to meet with the union, and so the union will also be informing teachers and instructional assistants and the groups that they represent on the work that's being done.
Okay. Okay, we're all set there.
Next one is
Sarah?
Liz Ferris. Liz Ferris.
Okay, sorry, I couldn't unmute. Hi, this is Liz Ferris. I'm also in Worcester. I have twin boys who were supposed to start kindergarten in the fall. And as you answered part of my question earlier, as far as being given the choice of remote learning, so I'm glad about that because I definitely have a lot of concerns about sending them off to school, especially if it's the first time going to kindergarten and having that anxiety around that, plus masks and all that stuff. So my question is, if somebody chooses to do the remote learning, would they have a schedule similar to the third model, the third week model, where there's like one day they get to have direct interaction with their teacher, and then would it be 4 remote days instead of 3 because they choose to do remote learning?
Maureen, is that for you or Dr. Markey? Or?
Either one of us. Mary, would you like to answer that one?
Surely, while there's much more to be developed on that model, we can say now that there will definitely be opportunities during the day for direct instruction with teachers, and then also independent learning with students, that they will have that time. But that is not defined as to what days and how long. That has not been defined as yet.
Okay, great. And then also because when I registered them, it was obviously before the pandemic hit and all that stuff. They haven't had their assessment yet. So is that something that's been waived because of what's going on, or how is that going to happen?
I'll turn that over to Dr. Morse.
Hi, Liz. That's a great question. We're working that out as a district team because typically there is that pre-K and kindergarten screening that's done early in the year. And if you're choosing to go fully remote, we would have to come up with a virtual way that we could assess your students. But we're working on that as you speak.
Okay. Sarah?
Yep. Sarah St. Peter. She was promoted to panelist. Sarah St. Peter?
Hi, can you hear me okay?
Yes.
Hi, thank you so much for taking me. My name is Sarah St. Peter. I live in Oxford, Massachusetts. I am a teacher in the Worcester Public Schools, and one of my big questions has to do with the slide talking about the busing. I teach the groups C model, and if you look at the busing, that's with them reducing it. If we have all of our kids in transportation, that will seriously affect how many kids can go on the bus. And so I don't know if that may be something that needs to be looked upon further. I know this is not an easy feat for any of you. There's a lot to be considered here, but this is just one thing that stood out to me. And thank you for the time that you put into this. But it is an area that dealing with busing at the end of the day, all of those groups C kids are going to be on the medium buses, and the spacing on that doesn't seem to work out, but maybe there's another plan in place. So if you can respond to that, that would be fantastic. Thank you.
And Mr. Allen or myself can respond. Basically, for the summer school students that we are bringing to different day programs, they're going to a bus right now. So that's why we're waiting for the guidance transportation, because it's going to make a big difference on how many students we can transport, exactly as you said, at one time. So the reason we haven't given the information out is that we're not sure what it is at this point. So once we get DESI's guidance on that, then we'll be looking how we're going to solve that problem with transportation. And I don't know if Mr. Allen has anything he wants to add.
No, I think we agree with the speaker that transporting the Group C students is going to be a challenge, and we await DESC's guidance on what they would exactly look like, and then develop the specific plans once we have that guidance.
Okay, next, Heather LaForest. Heather LaForest.
Hi, can you hear me?
Yes.
My question is, Heather LaForest from Worcester.
I'm sorry, please state your full name and city of residence.
Heather LaForest in Worcester. My son is starting the 1st grade and he's on the spectrum, so he has to have behavioral and speech therapy. And with the remote learning, it was okay. Right now, the summer school thing is working really well for him because he likes the boom cards and stuff like that. But I'm afraid that if he goes to school, he's more susceptible to getting the virus if someone else, another child or staff have it and they don't show symptoms. He can't wear a mask. He can't have the sensory on his face, but he has breathing problems. So that's my biggest concern is that, and he's not going to know, he doesn't understand the whole 6 feet apart thing. So how is that going to play out? Like, what are your plans on that?
Plans, on that was if you can't wear a mask, obviously, because he has a disability that would cause him to be very upset with wearing a mask, that he would not have to wear a mask. He would be in Group C, as we talked to you about, and he would receive instruction as long as our bus transportation doesn't cause any challenges 4 days a week, every single week. So now if you're saying that because he has a breathing problem, you're thinking that you wanted him to go full remote, that's something that special ed would work with you individually to see what we could do to help the child.
Okay. All set there, or Sarah?
Yep. Amy from Grafton Street says. Second. Okay, Amy.
Hi. My name is Amy Laporte, and my child goes to Grafton Street School. I have a couple concerns. First, I want to know what steps other than masks and gloves are being put into place to protect students, educators, and staff members if you're considering doing less than 6 feet of social distancing, especially if you don't know who's asymptomatic or not. That's my first question. My second question is for children that are suffering from anxiety due to COVID and have a lot of fear and stress around it. What are you going to do to support those children as they come back to school with these fears?
Well, I can talk about, the equipment we're going to be giving to students as well as staff. We have to go based on what we know, what we're being told by the scientists and from the DESI regulations. And that is every student will be required to wear a mask, whether they're socially distancing. When the decision comes, whether it's 3 feet or 6 feet within a classroom, they will have to wear a mask. They will have to keep social distance. Those are the basic things that we have to continue to adhere to and make sure they're being implemented on a daily basis. We know that hand sanitizer of some sort also prevents the spread of the virus as far as if you're touching something. In regards to washing hands with soap and water, we're making sure that each school has the proper, place where children can go and wash their hands with soap and water on a daily basis. We also know that the disinfecting process, we have to come up with a specific plan on a daily basis to make sure that our tables, our chairs, our desks, etc., are being disinfected to where students will not get exposed and possibly subsequently infected from the virus. Those are the things we continue to know we have to do. Anything thereafter is, once again, we're continuing to plan this accordingly based on the science, CDC regulations, guidance, as well as the Department of Elementary and Secondary Education.
Okay, Maureen, you want to add, or you're all set?
Second part of that is that we didn't mention it in the presentation because we're still working on it, but we are thinking of maybe changing the school calendar so that staff will receive 7 days of intensified training from the Worcester Public Schools. Some of the training will be on trauma and having children that are coming into school feel relaxed and feel that they're cared for and not be upset. You know, some students, when they see other people wearing masks, if they haven't seen that yet because they've been in their house or not exposed to people on the outside, that can be traumatic for young. So training staff on that, also our school adjustment counselors, all of them trained in trauma, resiliency, and they'll be, they're assigned to every single school as well as our nurses. So for any student that comes in feeling traumatized, staff will be well prepared to deal with that student.
Okay, Sarah?
Yes, 1 second. The next one is, just has the name Kathy, no last name. And they need to be promoted to a panelist, so where are they? Kathy? Did they disappear? Oh, there they are. Kathy? Kathy? Doesn't appear that they're unmuting themselves.
Okay, go on to the next one.
The next one is Catherine Brown. Catherine Brown. Catherine Brown. Okay, should we go to the next one?
Yeah, go to the next one, Sarah.
Okay. Next one is Kathy. We have a lot of Kathys coming up. Oops, hang on. A second. Okay, so next one is Shara Monfields.
Hello.
Hello.
Thank you for having me. Shara Monfils from Worcester, Mass. I have a few questions. I'm a mother of 3 students. 2 are in Elm Park Community and 1 at Forest Grove. So far, me and my husband have talked, and we've been both concerned about the upcoming year. You know, not due to the fault of anybody working in the school system, but I don't feel that there is going to be enough of, you know, active cleaning. There's no possible way to clean after every single person that's in the school. There's doorknobs that are used. You're gonna be able to clean the doorknob after every time somebody uses one, in or out. The bathrooms are unsanitary as, you know, already. They're probably the most unsanitary area. And then to add a virus to that, it's just going to make it so much worse. And kids are just, they're kids. They don't pay attention. They get things everywhere. They splash in the bathroom. They make messes. They pick their noses. They pick their bums. They're just kids. I love mine, but kids are just kids. they're not always the most observant of things. So you've got to be aware of all of the things that are going to come up, not just masks and 6 feet apart and so on and so forth. You know, I feel bad for teachers at this moment. I don't feel that it's great for them either. I'm concerned for them on top of being concerned for the students, because it's kind of like, do I go to school and put myself at risk, or do I lose my job? And I'm not a teacher, nor do I know any, but I feel absolutely horrible for them because this is a really bad time. And I know that they really, really love their jobs and they love their students, but this is a scary time for everybody. My husband works in a hospital and he's at risk all the time. He has to be tested round the clock. And I feel that my kids being at the school are putting other people at risk. And I don't want them being put at risk either. So I personally am going to take on the task of having them do the remote learning the whole year, which is not going to be easy, but I feel it's for their safety.
Okay, thank you for your comments. I much appreciate. Point taken. Sarah?
Next one is Rachel Russell.
Hello.
Hi, Rachel.
Hi, my name is Rachel Russell and I'm from Worcester. Most of my questions have been answered by other people. I have 2 children in the Worcester Public Schools. They both went to Roosevelt. Huge shout out to the teachers in the life skills class that my children were in. They did amazing since March. They were great. They were amazing with the home stuff. I am terrified to send my kids back to school. They are walking petri dishes. You know, they taste everything, they touch everything, they're nonverbal, they can't tell me when they don't feel good, they can't tell me anything, you know, I have to guess. So I am going to opt to do the home stuff, which is so hard. It was hard on me, it was hard on them, but we're gonna learn together and we're gonna do it together. And I'm sure that the teachers will be just helpful. My question is that I did receive 1 Chromebook and I got it towards the end of the year, so we didn't actually use it yet. Will I be able to get a tablet for my younger child for the home stuff?
Yes, Rachel.
Maureen?
We're going to be a one-to-one district. So every child that goes to the Worcester Public Schools will have either a Chromebook or an iPad for the younger kids. And if there's a problem with connectivity, Rachel, I don't know if you have a problem with connectivity. We also have hotspots that are also still available.
So we just got our connection thing figured out through Charter. But, you know, like I said, you know, I want to give a big shout out to the teachers, man, because they really pulled through and we're all learning. Like, this is so new and everybody needs to give everybody a break and it's still going to be new. So thank you to everybody. Seriously.
Thank you, Rachel.
And thank you for your, no, thank you, Rachel, for your comments. Much appreciated. Sarah?
Yes. Walter St. Dennis.
Walter?
Walter St. Dennis from Worcester. My first question is, with parents giving the option of opting out and homeschooling, going completely remote, why are parents not being presented the option to opt in for full-time instruction? In the presentation, there was a portion that said there a 3-foot distance between seats. There are 25 schools that can accommodate 100% of the students. What schools are these? In addition, why did the administration not take into account moving students from different buildings to afford a 100% student body. My next question. What is the plan for kids that are remote learning that are not doing their work? What about keeping parents on top of their children? While we were in this remote learning process, I had a few conversations with teachers and principals, and the response back was, what am I supposed to do? I cannot go to these kids' houses and pull them out of bed and put them in front of the computer. How are you going to do the MCAS testing? How are you going to do standardized testing to make sure that kids are keeping on track? In bringing Chromebooks back and forth, when these children do break their Chromebooks, who's paying for it? Are the parents paying for it, like it says in the little thing that we got when we signed our Chromebooks? What about low-income families and subsidized families? Are those people just getting a pass to break these Chromebooks while other taxpayers are paying for it? Hand sanitizer. Has any of this hand sanitizer that's been ordered been reviewed and checked against the FDA list for methanol? What about personal hand sanitizer that people are bringing in? Is that going to be checked against the FDA list for methanol?
Okay, we'll try to address some of those questions.
Hold on there, Mayor.
You want to address?
I'm almost done. Worcester kids that went to school with positive TB and positive MRSA in the past. This has already been addressed. You know, what about those students? Lastly, Superintendent Benenda made a comment about how parents are not allowed to see other students learning, which is why we can't do some, you know, great Google Classroom thing. However, during remote learning, we all got to see other kids learning. So how are we going to make these concessions and follow all these guidelines when in fact these guidelines and these concessions do not work?
Okay, thank you. Superintendent, do your best.
First of all, as far as the MCAS goes, that's a state decision, and that decision has not been made that next year MCAS will be given. As far as the Chromebooks go, it's the same for everybody. It didn't say that anybody needed to pay if it got broke or got lost. We would replace those Chromebooks for anyone that loses their Chromebooks because it's our way of teaching all students. I think that maybe there's a confusion generally out in the public that full remote is homeschooling. Those are two separate things. Homeschooling means you're no longer a student in the Worcester Public Schools and you don't have access to resources, where full remote means that you are still a student in the Worcester Public Schools and that you have access to all our resources, and it's an online learning program. Let's see, what else did you ask? You asked a question about the students that have MRSA, and I wasn't quite sure what you were saying there, but basically, if a student has MRSA or any infectious disease and they come to school, obviously we follow the guidelines, the health guidelines. We don't exclude unless it's allowed to be excluded through the health guidelines that we receive. Was there a question, Walter? What was
okay.
it?
No, well, I think it got most of that. So, Sarah, do you have another question?
Next one is, all it has is a number, 502-468. $502-468. No one?
No, go on to the next one.
Okay. Next one is Walter St. Dennis.
We just had Walter St. Dennis.
Oh, okay. Sorry.
Go on to the next one.
Yep. The next one is just SE. SE. Next one.
Hello, yes, good evening. Can you hear me?
Yes, we can hear you.
Okay, wonderful. Good evening. Thank you so much. My name is Sakina Ellis. I am of two McGrath students, one going into 6th grade and one going into 3rd. My questions are, what are the measurements, if any, about absenteeism? Considering that I saw something about grading is now going to be happening, which is different from the remote learning model that was put together at the end of the last school year. So grading is happening this upcoming school year. Is there anything in there about absenteeism? I mean, with the reduced amount of days in person and remote learning, the total number of school days are there, but if someone misses something because of whatever reason, maybe they're having a down day, maybe they are affected by COVID, maybe, I don't know, something else going on, is that going to negatively affect their absence, their presence at school? Secondly, the Chromebooks, are those going to be issued on the first day of school, or the first week or month? What's the expectation on that? Thank you.
In August, that's when we're going to be issuing the Chromebooks so that students have them prior to school beginning. Second of all, what was the other question you had? It was the Chromebooks. Oh, and also about, what was the first question? Oh, it's absenteeism. So we're waiting for guidance from Department of Elementary and Secondary Ed regarding absenteeism, because right now the health guidelines that we've been given said that if students or staff do not feel well, they are to stay home. So, in the past we would say, you know what, go to school, right? You'll be fine once you get there, or you'll feel better later on in the day. We can't say that with COVID. So if a student does not feel good or a staff member does not feel good, they have to stay home. So because of that, we do have to look at the attendance policy, and we have to change it so that kids aren't feeling that they're going to be punished because they weren't in school because they were sick.
Okay, next, Whitney Goldstein.
Hi, I'm Whitney Goldstein from Worcester, Mass. I work in one of the colleges in Worcester, and one of the questions I had was if there is a remedy or a vaccine come spring at some point, would they switch back to all in person? That was one of my questions.
So Whitney, so my answer to that is, it's pretty unlikely, right, that will happen. But if it does happen, that's why we have a hybrid model and an all remote model. And the reason why we have it is so that we can pivot, right? If something happens and the virus is no longer here or is greatly decreased, then we can pivot up the hybrid and we can bring more kids into school. But if the virus gets worse, then we pivot the other way to all remote.
Okay, thank you so much. And I just wanted to say, my daughter, she's entering kindergarten, and obviously, you want your education for your child and things like that. But, we're going through so many, protocols within higher ed and different things. So I'm very immersed in all of this as well. And I just think, obviously everyone's going to have their own opinions, but there is a lot that I think depends on the leadership and each school, whether it's the principal or whether it's the teachers and different things. And I don't want to ever say we would want to risk those teachers' health or anything like that. But, my daughter's also in camp right now, and where she's going, they've done a fabulous job, and it's been wonderful. And it's been a level of socialization I feel that some of these younger, people do need at this point because they have to grow. And so I guess I'm just going to present a little bit of a different perspective from what I've kind of listened to a little bit tonight. Because I do know how fluid and how different, and every day something's changing. And I just wanted to say I appreciate the work you guys are putting in, and I do think, whether it's washing hands, wearing face coverings, just doing diligent things, coming home, showering, whatever it may be, things can work in a modified form, and it doesn't mean necessarily someone's going to get coronavirus. And so I just wanted to thank you. I appreciate your work. And I think that obviously everyone's opinion is valid and it means something, but I do appreciate what you guys are doing.
Okay, next one is Robin Milazeski.
Hi, good evening. I first want to start by, I would like to commend Mr. Gates. I think he stated very beautifully the concerns of many of the parents and staff. Oh, I'm sorry, I'm Robin Milashewski from Rutland, but I am a Worcester Public School employee. Sorry, I forgot to state that. But yes, I believe that Mr. Gates really spoke very beautifully about a lot of the concerns that all of us are having as parents and educators. I have two questions. In an earlier slide during the presentation, you indicated that either one of the hybrid models would be able to easily convert to the remote instruction as needed. So my first question is, why would we not plan to start remotely for the safety of all of the students and the staff of the schools, the bus drivers, and so forth, and then convert to hybrid as we hope to see the trend of the virus eliminated? So that's my first question. And then my second question piggybacks on something that Melinda brought up that I don't believe was addressed. You keep stating that there are going to be 100% remote learning options for students. So parents can opt in and say that they would like their student to be remote learning, but we haven't been given any indication that that's an option for teachers who have concerns about being inside the school building.
Okay, so our expectation is that all teachers return to the school building, both those teaching remote and also those teaching in person. So that's our expectation, Robin, at this time. Certainly those teachers that, have certain physical illnesses that may have already contracted COVID, have the doctors know, those will be exceptions to the rule.
So, okay, so you're saying then that if there are staff who are exposed, are immunocompromised, care for an immunocompromised spouse, parent, child, then they will be given the option to be remote? So that will depend on an individual basis. Our expectation is that everybody does return. And also on your first question, regarding why don't we start remote and then go to hybrid? So we have to present to the state 3 plans, right? The first one, even though we're not accessing it, which would be 100% of students in school with 6 feet, because we can't do it physically, we still have to present a plan to the commissioner. The second plan we must present is a hybrid model. And the third is remote learning. So the reason why, we're sharing.
El segundo plan tenemos que presentar un modelo híbrido y el tercero es aprendizaje remoto.
I think our channels are mixing up. I'm sorry.
Okay.
It's okay. I think Maureen answered the question, Sarah.
Yeah, just the reason why we are presenting the 2 hybrid models is so that everybody can give us feedback on which hybrid model they would prefer, or feedback on each of those. So that's why that's being presented tonight. And then the full remote would be fully remote.
Por eso es que ese es el énfasis de esta noche.
Thank you. Next question, Sarah.
Plan completamente remoto.
Paula Chaput.
Hi, thanks, Chef at Worcester. I have 2 very brief questions. One, if parents do opt to utilize the 100% remote learning option, can we expect to see a similar structure to what took place just most recently? And then my second question is referring to Group C, specifically those in substantially separate classrooms. Does the district have any guidance on how to manage grade B inclusion among cohorts so as to maximize the effectiveness for those students learning, as well as the safety of other students in general education classrooms?
El aprendizaje de los estudiantes en general.
So, first group, so inclusion students would be group B and not group C, because they are, as you said, Paula, included in the regular curriculum.
Excuse me, Madam Superintendent, it's Group B.
Group B rather than Group C, correct. Isn't that what I said? Did I say? I think I said Group B, not Group C, right? Is that right, Doctor?
Yes, it'd be Group B.
That's what I thought I said. Sorry, I didn't mean to say Group C. It should be in Group B instead of Group C.
Okay, we all set? Did you answer both those questions? Okay. Sarah?
Hey. Oh, can I finish that question about the remote learning? The remote
Oh,
learning,
yeah, that's right.
remote learning going to be the same as it was in the spring? That answer is no. We did do a presentation for school committee last Thursday, and we called it Lessons Learned. And those are the things that we learned. We then implemented in summer school this year. I don't know if your child attended summer school, but we are just analyzing now the results from that. And we have not gotten one negative comment from either a student that participated, a staff member, or a parent. And so those were changes that we made based on what we learned from the spring. So it would be very different than what you experienced in the spring.
Okay, well, thank you. And we're going to keep on going, Maureen. Is that all right? As much as we can. And I know we have a number of, we have 500 people on the line still. I think we have like 80 or something more questions. So if people can keep a limit to the questions so we can get through to everybody and that we've been waiting, that'd be great.
Yep.
Go ahead, Sarah.
Yep. Did we take Paula Chaput? Did we already do that?
Yes, we did, Paul.
That's the last
Sarah.
one. Ji Yang.
Ji Yang.
Mm-hmm. Ji Yang.
Hello.
Hello, we can hear you.
Thank you. First of all, I want to say we did have a really good summer school experience. I signed up my son. He was not happy. But guess what? 2 days into the class, he got up in the morning. He said, "Hey, I can't wait to get into the summer school." I think that's what we really can improve compared to the spring session. Kids need human interaction. The live class gave them a chance to interact with the teacher and the students. So besides this, I have two questions actually. One is, does the school plan to have a surplus of teachers just in case there's a teacher called out? Because I don't expect you can easily bring in temporary teachers who, might not have a lot of training on those special things. And also, there's probably some teacher, like they mentioned earlier, have their family situation, personal situations they cannot teach. So that's one thing. Number two is there any chance we can extend the class time to beyond 2 o'clock? I'm saying that for two reasons. One is the reduced in-person class is gonna affect the kids. If we can extend the class time to longer, to let's say 4 or even 5 o'clock, we might give kids more chance to learn interactively in school. Another reason I bring this up is a lot of parents, I assume, is going to make a lot of sacrifice, taking their time from basically stay home because their kids are too young to stay home by themselves. If we can extend the school day, they don't have to worry about coming home early for their young kids all have to put their kids in a after-school program, you know, we all know that's another mix of prejudice. That's my
Please. Madam Superintendent?
Yeah.
Maureen?
So we don't expect that we're going to have any substitute teachers. We are receiving information from people that used to sub that during this COVID time, they're not interested in subbing. So we know that that could be a challenge. So it'll be up to the principal in every single school to use the resources that they already have in their building. We cannot extend the school day for a lot of reasons. One is for bus transportation. The second is the teacher contract. There's only a certain number of hours that teachers are paid to work. And the third is we have to clean our schools every day after the students are in there, so that the schools will be clean and the next day. One of the things that we are, exploring is that what opportunities can community partners offer for our students, and so we're exploring that at this time. So more information will be coming about that.
Okay, thank you. Sarah?
Oh, Amanda?
Hello, can you hear me?
Yes.
Okay, my name is Amanda Monahan and I am from Worcester. I have 2 children that go to Cityview and I have 2 questions. So one, I think I understood this, is that it's going to be more similar to the summer school program that we just finished than last school time that we were doing the district learning. I just wanted to make sure that is correct because I saw a huge difference between my children paying attention when there was an actual teacher that kind of facilitated their learning as just read this, fill it out, send it back. The second thing I wanted to know is if at the beginning of the school, my child is put in group A and we see that for some reason she's not picking things up, she's falling behind, is there the option to go down to the group B where she may get a little bit more instruction? Because I do not want my child to fall behind just because she was put in a group and that was the end of the discussion and she can't move or fluctuate depending on her learning needs. Thank you so much. I do appreciate you guys and I have so many concerns for your health, our health, but I just really hope that we can all work together to make sure that everybody is as healthy as we possibly can make everyone. And so I did really enjoy the summer program that we just finished. I will say I was not a fan of the end of the school year. I felt very much like it was just too much of a learning curve for everyone involved, students, teachers, and us parents. But the summer school was awesome, and I do appreciate all of the teachers at Cityview. They have tried so hard to keep us all in contact and find out what's going on. So thank you. Have a great night.
Thank you, Maureen.
For your wishes of well for everybody too. Yes, the program that we're talking about for remote learning is has the same components as the summer school program. And as you did say, the remote learning that had happened very quickly and have 3 different changes in the way that we had to give it by DESE guidance. Everybody was thrown in the program to do the best they could. That was parents, that was staff, and that was students also. So the remote learning that we're offering now is based on the lessons learned and the programming pilot we did this summer. So as your question as could your child move from one group to another? So we would hope that if your child's in group A is having challenges, that they would still be able to stay in group A and receive the extra support they need. The reason I say that is the students that are in group A and the students in group B, there'll be a certain number of kids that can go into a classroom. So there may not be an empty space in group B for your child to move into. So depending upon what group you get into, and based on the guidelines that we provided, our first responsibility would be provide that support that your child needs to be successful in Group A. And then if we find it more and we would have to move them, it would be dependent upon a space. If we have to do that social distancing in the classroom.
Okay, thank you. Sarah, the next question.
Next person is Donna. Donna?
Okay, Sarah.
Can you hear me?
we'll go to the-
Yep.
Yeah, we can hear you.
Okay, I have a couple of questions. What are you gonna do with little kids that have asthma, the breathing problems? Because I've lost 2 siblings during this pandemic. One as it was hitting and one in the middle of it. I'm concerned about my grandson because he's got asthma.
I'm sorry for your loss on asthma.
Yes, Donna, I'm sorry to hear that. So for asthma, we would treat the students that have asthma the same way that we have all along prior to COVID. And we offer the same guidelines that we're offering, for other students right now, based on what the medical people are telling us.
Because last year he's had several asthma attacks at school. He's wound up getting sent home because he wound up with strep throat.
Oh, wow. So Donna, I think, the reason why we're presenting several of these options is so that you can think about, what is the best option for your child based on your child's health.
Okay.
Okay.
I wanted to say hi to Diana and Rob. I used to work in Worcester Neighborhood Center.
Okay, thank you, Donna. Sarah, next question.
Anna Grenier. Anna Grenier.
Hi, can you hear me?
Yes, we can.
Hi, thank you. I'm from Worcester. My children go to Worcester Technical High School. I have 2. I was just wondering if you guys have considered a model plan for the shop weeks. My 2 kids are really missing their shop and they are worried about falling behind and things like that. So I was just wondering if you guys had any plan for that.
So Anna, we met with Tech last week to go over, some of the challenges that would be there for the shop week. And Worcester Tech administration and vocational director and ourselves are working on that. But I also want to tell you that the vocational shops are also governed by Chapter 74 rules. And this week, the guidance is coming out about the school shops. So we're anxiously awaiting that. We do feel as though we, think that the plan, one of the plans in particular, does work better for Worcester Tech in the hybrid models. And so we'll be sharing that information. So I would suggest that you keep an eye on our website so that as updated DESE guidance comes in, we'll be posting that also about Chapter 74 programs.
Okay, Sarah.
Okay, thank you.
Okay, the next one is Melinda Rainwater. Melinda Rainwater.
Hello?
Hello, we can hear you.
Hi, I have a question. I think someone asked it earlier, but are you guys considering starting all virtual at first and then maybe going in person full time, like after Christmas break or after Thanksgiving?
Melinda, so we're considering quite a few options at this time. Right now, we're considering a hybrid as a pivot point so that if it works, we can go to all. If it doesn't get worse and starts to get better, the virus, then we could add more students into our hybrid model. So at this particular point, at this presentation, That's what we're considering right now.
Okay. Thank you. Sarah?
Susan Sullivan.
Hi, this is Susan Sullivan from Worcester. My first question was actually about Worcester Tech, and I think you just answered that about that you don't have a plan yet for how they're going to do shop. My second question is, my son is on an IEP that's been on a stay put now for over a year. And I have a lot of concerns about how that's going to get resolved, especially given the new remote learning. And with that, someone had suggested, and he's in an inclusion classroom. So my question, of course, is how are we going to look at stay puts and how they're going to get resolved? And then also, is there the ability to have extra tutors for these kids that are in inclusion classrooms? Because I know during the spring, I spent probably 4 to 5 hours every day working with my son to help him just get through what the assignments were and get him organized enough to do the work.
Okay, Maureen?
Hello?
Maureen, you're on mute.
Hey, Kay, we can hear you.
I am. I'm going to put Kay on, please seal on. But before she starts, I just want to say that one of the areas that we didn't implement and during the spring remote was the use of our instructional assistants as well as we could have. And part of that reason was they did not have access to Chromebooks. So we have ordered Chromebooks for all our instructional assistants. So they'll be able to help our inclusion students, both in person and also in the remote world. And I'm going to ask Kay Sale, who is our manager of special ed, to address your first question.
Hi, good evening. I appreciate the parent's question in regards to stay put. And in response to your question, there is a process through our program resolution system that we could have a meeting with a mediator to address your concerns and to reach a resolution in regards to your concerns in regards to the IEP. It is important for you to realize, and I'm sure you do, that the stay put provision will ensure that all services will be in place based on your last signed accepted educational plan. So if you would like to move forward with a mediation to address your concerns, we can work with you collaboratively through the PRS process and schedule a meeting with the mediator.
All set there? Okay.
Well, actually, I just have one additional question. If I opt not to move forward right now because of this unusual circumstances, is there the ability to add any additional services because of the change in how they're now learning?
That is done through the team process, and I'm not sure any specifics regarding the level of needs of your child. We are in the process of identifying and coordinating meetings for our students as a result of the closure. If there's a need for us to do additional evaluations, then we need to take that into consideration. But part of the process in regards to adding additional services will have to be done through the team process. So we would have to reconvene your child's IEP team meeting in order to address the need to have additional services. But typically that is done through updated assessments or new information.
Okay, and new information could be that we're in a pandemic and doing remote learning.
That is not considered new information. Those are unfortunately unprecedented circumstances. So new information really results in evaluations and or any types of updated assessments or data collection that we can use to really determine the progress that your child is making as a result of the school closure, as well as the services that your child has received through the remote learning process.
Okay.
Okay, thank you. Sarah, next question.
Susan Sullivan.
We did Susan Sullivan already, I think.
Oh, okay. Rose Barjolo.
Thank you for this meeting. My name is Rose Kimboy Bajolo. I'm in Worcester, and my daughter has been going to middle school, but she's going to Bangor High. She wanted to go to Worcester Tech, but because they were still assessing her special needs, because she needs help, so they were still to process that. But because of COVID, everything came to a standstill, and they had to get back to me. My daughter has allergies also. She uses inhaler, and also she has heart issue, but I'm still to follow with heart doctor. So for her to use the mask, I don't know if she will manage to walk to school with the mask with all this, because she just passed out 3 weeks ago, and now we have to see a heart doctor. So I'm having issues which personally herself, she wants to go back to school. But for me as a mother and as a parent, and seeing her falling here at home and fainting, going to the floor while she is standing, I'm really scared to death. For her to use the mask and walk up to, we live near Hahnemann Hospital, so walking to school to Bangor has not been a big issue, but right now I don't know exactly. I'm just in darkness, and she wanted really to go to Worcester Tech, but now we are just considering that she better go to Bangor High School, and she wants to be in class because she needs help. She's still adjusting because she came from Africa. So I don't know. I'm in darkness, and I congratulate you teachers. I congratulate all of you for the work you have been doing. Because for these last few months we have been home, some of us cannot help them. So if they get stuck, we get stuck the whole day. Congratulations for the work you do. God bless you.
Thank you. Maureen, do you have anything on that, on the technical?
I would say, Rose, that I think Bronco is a great high school, and they'd welcome your daughter. And the only suggestion that I would give is that, you send an email to Mr. William Foley, let him know about your daughter, and so that they'll be able to give you the support she's going to need. And also the nursing office is aware of the fact that she's been fainting, as you said, so that when she goes to school, everybody will already know what she needs, and she'll be successful there.
Okay, thank you. Next question, Sarah.
Yep, Lavinia Silva.
Hi.
She goes to school.
Can you hear me?
Everybody will already know what she needs.
Yes, we can.
Yep. Go ahead.
Thank you for taking my call.
Thank you. Next question, Sarah.
My question is very simple.
Lavinia.
My husband and I both work. My daughter won't be home to have a one-on-one with her teacher if it's the third option. So we want to find out how is her situation can be resolved. She's going to be in some kind of child care. She's not going to be able to start her learning until she comes home at 3 o'clock in the afternoon, days there are no school. How does that go? How can we do? It's not possible for me to put my daughter from 3 to 9 p.m. doing schoolwork. That's not gonna happen. It's unrealistic. How can parents, working parents, can accommodate this? My husband works in the OR at UMass. He's been exposed to the COVID, helping patients with COVID all the time. He does not have the option and the luxury to say that he want to go 2 days or 1 day. He needs to be there. He's exposing us. So how are we going to be accommodated here?
who's been exposed to the COVID, helping patients with COVID. So the only answer I have is that either, you know, you get somebody in for daycare, I know for those people that are first responders, that there are certain daycare centers that do take children of first responders, because the only thing we're going to be offering is the hybrid that has a remote part or full remote. So I would suggest that, you know, maybe you contact some of the centers that did provide daycare during the spring and are still doing, some of them still doing that, to see if they're going to be available. And then if you're asking about if the child stays home with you and then at night, how will they do the work? Well, some of the work that we're going to be providing, students can do that independently. There'll be some videos that students can use that can be used after the regular school hours, so that instruction can still continue for your child.
Okay. Next one.
Okay, thank you.
Nicole.
Nicole, you're on mute. Go ahead. There you go.
Sorry. Hello. My name is Kathleen Perret, actually, and I'm a Worcester resident. My son will be going into second grade at Worcester Arts Magnet. He has epilepsy, and my wife has type 1 diabetes, so we'll be choosing to do fully remote. I attended the meeting last week where it was mentioned that there might be a case where they're using a state program for doing the remote learning. And that makes me really uncomfortable. One of the saving graces of this spring was my son's connection with his teacher, and having her be able to know some things about him and send him some things that he was comfortable learning. And I had to adapt a lot of his work because he also gets special ed services, and he just got diagnosed with ADHD. So I'm really worried if the remote learning will not be flexible to letting him have some different means of learning besides just being on the computer.
Go ahead, Maureen.
So I'm not sure if you're talking about the hybrid or the full remote. However, both of those will have very different from the spring, but still a component that you like the most is contact with your child's teacher, is what we're focusing on to be the most important part of that. So the conversation we had about the state remote program is the state is looking into, they put RFP for a company to offer online learning. It's a full online learning company that's had a lot of experience doing that in the United States. And that would be an option for us to pay per student for access to that program. So all our students would be doing that. Obviously, we're also going to provide our own online remote learning program also for our students.
Okay, thank you. Bob, our next person.
Here we've got Mark. Mark, I've unmuted you.
Yes, thank you. How you doing? How you doing, Joe? Nice to see you. I have a few concerns about this plan. What about the social emotional? I'm an educator. First of all, it's Mark from Worcester. I'm sorry, but I'm an educator in the largest district in Massachusetts, and so I'm sort of like a frontline person, right? And I've seen what's going to happen, right? We know what's going to happen to when these kids go back to school. That is going to happen. Kids are going to get sick. It's going to happen, 100%. And so I worry about that. We're running into this. I know we got to check a box off. We have to give the state what they want. But what about this? Safety should trump everything. Safety should trump everything. We are in a pandemic right now. It didn't go away. We're still in it. And we know that when kids did 100% online, we know the results of that. You know, Superintendent Menendez, you know the results of that. You know kids were getting at 9, 12 o'clock, not going to classes, so on and so forth. That was happening, and it's going to continue to happen. And so one of the questions I have, what about the learning gaps? Kids are not learning. They're just not. Regardless of what you say, you know, it sounds good. It really does sound good. And I applaud trying to put together a plan. But when we peel back everything, what are the kids learning? Especially the lower grades. The high school, I can understand. They're more independent learners. But the lower grades are dependent learners.
Okay, Maureen, you want to try to address some of that?
How are we going to address the learning gaps?
Okay, let's give it a chance. Go ahead.
Thank you.
Okay, so Mark, you know, we all agree with you. There's a pandemic out there, and we also agree that best learning is person to person. There really isn't a better learning than a teacher and students in a classroom, right? We all know that. But again, because the pandemic is there, we have to think of another way that we can be effective in offering learning. So the hybrid model. So our thoughts on this is not the first 2 weeks students return to school, but sometime after the first 2 weeks to assess our students and where are they, what gaps have occurred during the time they were out of school, and then share that information with principals and with coaches and with special ed teachers and everyone that works in a school, teachers, counselors, and develop a plan at each school so that we can address the gaps that happened because of the time that we were not in school.
Okay. Okay, thank you, Maureen. Our next question, Bob?
Sure. The next person is, her name is Shayna. And 1 second, Shayna. Could you state your full name and city of residence?
Hi, my name is Shayna Belcito from Worcester. I just wanted clarification on teachers like myself that have underlying conditions. The lines were crossed and I couldn't hear the response, but I'm a physical education teacher with type 1 diabetes, and I'm extremely fearful to enter the buildings. I teach at 2 buildings. I see over 600 students, and I just wanted clarification if it was said that a doctor's note would be sufficient for accommodations to teach remotely from home.
Maureen?
So,
There you go.
yep, here I am. So the answer on that is that there are doctor's notes that will be accepted and they would go into HR, and depending upon the circumstances, either people would be asked to take the COVID leave, which, you know, is 12 weeks, but you only get 2/3 of your pay, or those people that are eligible, right, that say they cannot go forward, HR would have that conversation with them on what are the options are. So it's really an individual answer on this, simply because someone, you know, has diabetes. It may not be a reason why they can't return to teaching in school. So I would be an individual conversation, definitely, with HR on that.
Okay. Bob? Still there, Bob?
Yep, I am. Let's see, 1 second. I've just unmuted the caller, but now I can't see their name. 1 second.
I just unmuted myself. I'm all
There
set.
you go. All right, Tom, would you please state your name and city of residence?
Yeah, absolutely. Hi, my name is Tom Donington from Worcester. and I teach in the district. And through this whole experience, I've really missed my students. I love my students. I want to thank all of you guys for listening to me, and I also want to thank so many people from the community for participating in this and for your support. I also want to say I really appreciate the work that went into creating this presentation. I know that DESE has given us some marching orders and that everyone is trying to do the best they can to meet what we have to do. And so I really do want to, you know, have support for the work that's been done, which is a tremendous amount of work. In Worcester Public Schools, we are used to doing more with less, which is something that, you know, we all take a lot of pride in, or I know that I do. Like, by the nature of our district and the economic reality of life, like, we have to do that. And I know that I have a tremendous amount of respect for my colleagues in the administration for that very reason. Like, like the people that choose to work here and are, you know, doing it for a reason. But at the same time, I think the guidelines that DESE created that we're working towards, that we're trying to meet, were created with the view of shoehorning and allowing us to put people into the buildings as they exist to some degree with some modifications, and not really aligned with what we actually know is best for public health. So even as we're meeting these guidelines, I feel like the idea of going back into the buildings is a mistake. I just know that from the reality in my building, the first few days of school last year, we had some rooms that were over 100 degrees or in the high 90s. We don't have, in our windows, we have issues with PCBs, and so people are afraid to open the windows in a lot of instances. Like, the reality of kids wearing masks and keeping them on for the entire day, it's just not a reality. It's a fantasy. And we know 3 feet isn't sufficient. We know this is airborne. We know we don't have good HVAC. Like, we know all of these things. And we know that the DESE guidelines are not in line with what we've all been told in real life. So I just feel like, despite the fact that everyone's doing the best that they can, the virus doesn't care that we're doing the best they can. The virus is going to work on the basis of reality. And the reality is doing the best that we can isn't good enough in the building settings. The reality is, I feel that if we move ahead with this plan, lots of people will get sick, lots of people will die. And I just want to speak in support of Mr. Gates' proposed solutions, and thank you for your time. And if any of the school committee members could comment on that, I would appreciate it.
No, I think we commented on it. We're in agreement with what you're saying somewhat, and we're going to be trying to make the best decision for the safety of the kids, the parents, and the teachers. And so this is our first meeting. It's more to come, and we're just going to be ready to do whatever we have to do to make sure we get a good education for our kids and our teachers are safe. And Sarah, Bob, our next question.
Sure. I have, do we do Ann Morales? I mean, sounds familiar. I'm going to unmute her. Ann Morales?
Yes, hello?
Yep, we can hear you.
Hi, Ann, go ahead.
Ann, could you say your name and city?
Oh, yes,
please?
I'm sorry. My name's Anne-Marie Morales. I live in the Burncoat area here in Worcester. I have one child that's going into high school this year. I know a lot of parents will agree with me that the remote learning was quite challenging this spring. my question is how will this improve coming fall and following spring with the communication with teachers, and what will you do to support the mental health of students while they're doing remote learning?
Okay, so as far as supporting the mental health of students while they're doing remote learning, I think one thing we did learn that was very successful in the spring was that contact with those teachers really did help support the mental health. Another part is that we're going to be doing Google Classroom. Every single teacher has to have a Google Classroom. So students get to see, we don't record, obviously, what's happening in there. That's why we're not doing the videos from there, but students can see their friends in the Google Classroom. They can have communication with them. So that type of work will continue because we found out that was a lesson learned. As far as the work, the remote learning work, again, as we said before, it's going to be very different. And the plan that we submit is really a plan for the whole school year. So although, again, I want to state that at some point in there, we may pivot either where we allow more students able to come to school or we go to full remote learning.
Okay. The next person is, Feliciano. You're Luis?
Hi, good evening. Name is Luis Feliciano. I live in Worcester. Got this little guy here. He goes to Lakeview. He's going into first grade. Just want to appreciate all the hard work you're doing. And I haven't seen anyone take a sip of coffee, and I don't know how, but I respect that. And also want to just take a brief moment to say thank you for Principal Power and my son's teachers and the rest of the teachers over there. They did a great job ever since we went into quarantine. And another quick comment to the parents is, on our end, let's control what we can control. And then if you know you're going to go full remote, then just try to start getting into habit. Start a routine with the kids. I'm sure that come August, end of August, or beginning of September, whenever school starts, that's going to help them a lot. They're going to flow a lot better, and they won't be, the shock that happened in March. Hopefully it won't happen again. My first question is, have you looked at perhaps truncating the school schedule so that the kids say they would eat their lunch and then perhaps after they would go home? The concern is that when they go to recess, I know this guy here, he won't wear a mask, or he would keep it on, but if he sees his buddies, he's gonna get excited, gonna hug them. I mean, I don't blame him, but just a reality. And the second question is, can you give some sort of perhaps like a mock lesson or a video showing what like the remote learning is gonna look like? Obviously, we got a taste of it in March. But if it seems like in the summer it improved a little, so if that's what we can expect in the fall, it would be great just to get a taste of it so that we can start accommodating it into our schedules and just kind of get the flow going with our kids. Thank you.
Maureen?
So the challenge with half-day programs is busing. So we would not be doing half-day programs in the Worcester Public Schools. And what you say, your son want to hug his friends, and that's all normal behavior. And for some of that, I guess we're going to be working on trying to retrain students so that they realize that they can't do that. Although I'm sure that we have to recognize that that's going to be a challenge to do so. And as far as remote learning goes, we are still working on our remote learning programming, taking the lessons we learned from the spring and evaluating the feedback we got from the summer program. So we will be having some more of these community meetings where we'll actually be showing you what does the hybrid model look like per grade, and what does the remote learning look for both the hybrid and for the total remote. So there will be an update, and we will be sharing that information with you.
Okay.
All right.
Thank you, Bob.
Yep, and the next person I have is Carrie. Carrie Beauclair, I believe it is.
Hi, my name's Carrie Boyclair. I actually live in Rhode Island, but I'm a teacher at Worcester Public Schools. I just wanted to address two different concerns that I had. One is that I'm very concerned at the lack of discussion around teacher safety. I know it's a consideration, but I feel like sometimes that it gets left off of the conversation. One point that I was hoping you could speak to regarding that is in the secondary plans. Teachers that are being asked to go into school in both models in the 7-period day would be seeing 5 different groups of students, either 2 different cohorts or 3 different cohorts. And I'm wondering how you're planning to, aside from PPE and hand sanitizer, planning to keep those teachers safe, and also what would happen if someone in one of those cohorts was testing positive for COVID, considering we will have worked with a number of different students along the way. And then my second point I just wanted to make is that I hope that through all this planning that there is a strong consideration and attention to the fact that the arts in particular and the specials can really be a place of support for the social emotional learning piece. And I hope that they're continuing to be an important part of planning because as an art teacher myself, I see the benefits of performing arts in particular. And I think they're something that can really help students in the upcoming hard times, and did also in the spring and also through summer school, which I did. So if you could address the safety issue, I would appreciate it. Thank you.
Okay, Mary.
One that we now have teachers and students and community members added now to go deeper into the model is to be thinking about things like this. We did think when we were doing the schedule of many other ways that we might be able to do. For example, you pick up high school, but there really wasn't another way we can do it. So what we're tentative plans, again, these are preliminary plans, are for us to increase the time in the hallway so that the moving in most classes are 3 to 4 minutes to each class. We would extend that. There'll be up staircases and only down staircases. So students will be separated that way. If somebody, I don't know, a student or a teacher does get COVID, then we have to follow the state guidelines on that. Now, we were told guidelines came out Friday night. We put them on our website today. And we are told that additional guidelines are coming out by the end of the week. So we'll follow the guidelines to make sure that everybody is protected as we can have them be protected. And then the arts and the specials are very important to us. And I agree with you that a great way of really dealing with social emotional learning is the arts and the specials. And so we haven't forgotten them. And they are center. If you looked at the plans that we presented, like for the elementary schools, the arts are going to be taught directly on remote learning. So during those remote learning days. So we, and in the high school, the arts will be part of the schedule. The guidance that we have received, though, is that there's no singing, and you're not going to be able to play an instrument. Well, actually, I spoke to Lisa Leach today about that, and there are other ways that we'll be teaching chorus and other ways that we'll be teaching band during the school day. Of course, when they go home and they're on remote learning, we can do singing and we can do instrument teaching, but not just during the school day.
Maureen, if I can just chime in for a minute on the issue of testing. If a student does test positive to the virus, then what has to happen is that they've obviously been tested and it goes into a central database. The Department of Public Health is notified. They start their contact tracing to make sure that the SE guidelines say if a student's been in close contact for 10 to 15 minutes and they're positive, then we have to notify families immediately. And that's why we'll have a very aggressive notification process to let people know that a student or somebody's been COVID-19 tested positive, and then we will take the extra precautions for both students and staff.
Okay. Thank you. we have 38 more people who want to ask questions. I'm going. So next, Sarah.
All right. It's Jason. I'm going to allow you to talk, Jason. Can you state your full name and city?
Hi, I just, I'm sorry, my name is Jason Luciano. I have a student in Worcester as well as I'm an employee of Worcester. A couple of things is actually first, thank you all for hanging in there on a very long meeting. I know this isn't fun for anybody and I recognize you're all in a no-win position. So thank you for hanging in there and looking pleasant in the process. I've heard a lot of people ask, I'm a psychologist with the district, I've heard a lot of people bringing up the social and emotional issues and concerns for students. And I want to reiterate what Madam Superintendent stated, that we have some really good adjustment counselors and we have some really, really good and talented psychologists in the district who are all so dedicated to helping these kids through this time. And that gets overlooked sometimes. So I just want to make that comment to reinforce to the parents that are still listening that we really are looking out for all aspects of your kids' education. And we're here for them every step of the way. So the question that I had was specifically related to this plan that was proposed, and I understand it's preliminary, but we're hearing a lot of questions and comments about when children get sick and when staff people get sick and when the virus flares up in the school. And I understand that the contact tracing and all of these protocols are in place, but is there an element in these hybrid model plans for allowance of a shutdown again? Is there a threshold for we've got kids sick, they go home, that's it? Or is there a certain point that's entertained of we've got to do something a little more drastic? And if not, could there be? Thank you.
Jason, thank you for your work, but thank you for really mentioning the talented staff that we have. Because we have really dedicated staff and very talented staff. And now we got students and families through the shutdown initially, and it's how we're all going to get through this next school year. So the questions that you asked are questions that we've asked the commissioner. So when we did the initial shutdown on March 13th, it was the city manager and the mayor and myself and Dr. Hirsch, the commissioner of health, that we had that conversation. But after that, we did have to contact the commissioner of education to get his final approval of that. So the question, what we're waiting for is the answer to the question, who gets to decide to close down a school or to close down a district. So at this point, we don't have the answer to that. However, we would respond, obviously, if we have a high amount of COVID in one school. That would be immediately on that, and we would be looking for guidance from our health professionals.
Okay, thank you. Our next question, Bob.
Sure. We have Ashley. Ashley, I just allowed you to talk. If you could unmute yourself and state your full name and city.
Yes, my name is Ashley Rice and I live in Worcester. I just moved here a couple weeks ago, and I have a 3-year-old son who's autistic, and I submitted a request for evaluation, and I was told I would receive something in the mail, and that's basically not told anything else. And I just wondered if anyone could speak to what about the kids that aren't in the system yet, but need to get that process going. What can I expect time-wise?
That's a good question.
Maureen, would you like me to answer that question in regards to Lifeline? Part of what we're doing this summer for our children that are turning 3 is we are having arena meetings. So what we could do is we can get your information. If you have submitted a consent for an evaluation, we are doing evaluations virtually. So we can make sure that we do follow with the consent for us to move forward with an evaluation. So we do have arena meetings for children that are turning 3 before their 3rd birthday so that we can complete an evaluation to determine the level of needs for those students.
Okay. Did I answer your question? You still there? Okay. Bob, our next question.
Sure. I believe it's pronounced Kaylee J. you could state your full name and city.
Hi, my name is Joanne Callender, and I'm a Worcester resident. This has been a long call. I'm exhausted, and I'm sure most of you are as well. I have a daughter who's will be a junior at Doherty, an honor student. She's wonderful. And we will take the remote option for sure. But with that being said, she's enrolled in a few early college classes. She just completed one through QCC virtually, successfully with an A, no surprise. But the ones that she's taking in the fall are to be done at Doherty. Now, are those going to be virtual if in fact the rest of, the hybrid is ongoing?
Maureen? I don't know. It's a good question.
Yeah, hi, Joanne. Nice to see you on this. So those classes will also would most likely be remote, but we're still working. That's the part we're still working out with early college. So those were the classes you're speaking about that Doherty teachers were teaching. Was it English 101? Was it something like that? Go ahead, Mary.
Yes. So it would depend on what the model is. So the teachers, if she's taking classes taught by Doherty teachers, if they're in a hybrid model, it will be, if we're in a hybrid model, they will be hybrid. So there will be in-person and also direct and also remote. If she's taking classes from QCC directly, like at QCC, those would be the ones that are Worcester State. Those would be the ones that are remote. But at Doherty, there's English 101 and 102 and Art 131 and 132. And those, if we go hybrid, will also be hybrid.
Okay. Okay, next question.
All right, the next person I have listed, it says S&J Wagner. You could unmute yourself, state your full name and city.
Hi, this is Joanne Wagner and Scott Wagner. We're from Worcester, and we have a entering second grader at Worcester Arts Magnet School. I can say that I'm a little apprehensive about sending my son back to school, as many of the other parents on the call tonight have expressed. I think most of my questions have been answered, but I would like to have more details about the remote option as soon as possible so parents can make decisions. So that would be great. But one of my questions is, my son is a student at Worcester Arts Magnet School, and he's there through the lottery. So if we decide to have him do remote learning for the next year, what does that do for his standing at the magnet school?
So that does not negatively affect his standing. If you do learning, that's still Worcester Public School education. So there'd be absolutely no effect on your son for choosing full remote.
Okay. Okay.
I think she was also
Bob, I guess.
I think she was also asking, Mayor, when we would have the whole remote plan out there. It'll probably be the middle of August before every bit of detail is in that, because we are putting together a group of about 80 curriculum teams right now that will work on developing the remote learning model. So it would be probably mid-August before we have every bit of detail about it, but we will continue to give information as we build the model.
Okay, and I was also wondering, do you know when parents will need to make a decision about what their preference is?
So we haven't set an exact date on that yet. We're waiting until we get our model selected and sent in. We're thinking right around that second week of August. We would send another survey out, and parents would have to select whether they're doing remote or they were doing hybrid.
Okay, thank you. Bob, our next question.
All right, We have Maria Drury. If you could state your full name and city.
Hey, good evening. Maria Drury from Worcester, Massachusetts. So I wanted to say a lot of my questions were answered. I had a question about thresholding as to when you would basically kind of pivot and maybe go to 100% online learning. There is a anticipated resurgence of COVID in the fall, so I anticipate that you guys are probably looking forward to that. I did want to give a shout out to Maureen and the crew and you as well, Mayor. I think that you guys have been incredibly responsive, especially since, really it's been since Memorial Day that we really started to see a decline in the numbers as far as Worcester proper goes for COVID. So, thank you for putting something together basically on very short notice. But I did want to get into one question, which was, and I believe it was addressed a little bit earlier, and perhaps in the air a little bit, but surrounding attendance, especially those with the online option. A lot of parents work full time, are not going to be able to necessarily devote the time that's necessary to supervise, I think, the schooling of our kids. And shout out to the teachers. You guys do a great job. But what is attendance going to be looking like as far as a measurement goes? And then with the standardized testing, the MCAS, my child is going into a second grade kindergarten, so we haven't really encountered that yet. But 100% recognizing right now that all of the kids are behind. They're going to be behind. The traditional measures are not going to be where they are. So what do we think about pivoting and maybe resetting the bar for these kids as far as that goes?
Maureen?
So as far as the MCAS goes, that is totally a decision by DESE. And they really held that standard by the federal government, because there has to be one standardized test that every state uses. So in order for MCAS to be canceled, it has to be approved by the federal education component of it. So we would have to wait as far as MCAS goes to decide what we're going to do. Obviously, we have to follow what the state tells us on that. And what was the first part of that question, Mayor?
No, I think you got it there.
Is that it?
I think I missed it. I know I'm getting tired, but I think I got it. Okay.
All right. We've got Aaron. Aaron, you can unmute yourself and state your full name and city. Aaron Miola.
Can you guys hear me?
Yep.
Yeah.
Hi, my name is Erin Miola. I'm a Worcester resident. I have one student entering second grade and another entering preschool. Most likely, given the situation, we're going to be choosing the remote option. With that said, for over the spring, it was a big failure in this house. My then first grader, she just was not able to stay engaged in the virtual format. Luckily, it was flexible enough that I could kind of take what I wanted and the rest I could substitute with my own instruction. What I'm wondering is if choosing the virtual option, if not working, the parents, will they have that flexibility to kind of put it aside and provide their own meaningful instruction without having to formally unenroll from the school?
Maureen?
Erin, that's a good question. There won't be as much flexibility this time because students are receiving grades. And so teachers will be expecting that the work is done and returned back to the teacher. There won't be as much flexibility. Now, talking about asynchronous working with your child where they would be doing some work on their own, we would love that. Parents would supplement that with some of their own activities so that you could go deeper with your child, you can widen their experience, but there is going to be more expectations that the child does the work that the school is going to be providing.
Okay, all set?
All right. We've got Laura Gallagher. If you could unmute yourself and say your full name and city. Or maybe it's Lori Gallagher, I'm sorry.
What?
All right, we can hear you.
Or,
Hello.
okay, maybe she doesn't want to talk. So Bob, go on to the next person, maybe?
Okay, hold on 1 second. All right, we've got Holly.
Hi, good evening. Thank you so much for taking my comments and questions. I know this meeting has gone on really long. So my name is Holly Johnson. I'm a resident of Worcester. I'm a parent of two elementary students at McGrath, and I'm also an out-of-district high school.
Oh, I think we watched.
I'm sorry, can you hear me now?
Try to get Holly back
that was
on.
my
Joe.
fault.
Sorry about that.
Yeah, go ahead, Holly.
Okay, so good evening. Thank you so much for taking my questions and comments. I know we've been on for a long time. So my name is Holly Johnson. I'm a resident of Worcester. I have two elementary school students at McGrath, and I'm also an out-of-district high school teacher. I've been on committees myself to try to figure out how to return to school safely or get students to continue to learn. And both we and you have been tasked with the impossible, and I appreciate this forum. One thing I did want to address is that I'm a little disturbed that there has not been a separate meeting for Teachers First in your district, because this is their livelihood and most importantly, their lives along with our students. As a parent and outside of district teacher, I find it very disrespectful to your staff that they're having to ask questions about their jobs in a public forum like this. They will be our front line and they deserve to be treated as such. And I know that you all know that. So a couple of things questions that I did have. When you were speaking about the high school, how will classrooms be cleaned in between and who is cleaning the classrooms? Additionally, Ms. Benenda, you spoke about, you referenced about teachers either not being able to return to work, because of their, pre-existing conditions and things with COVID, and that there would be no substitute brought in, which is deeply concerning to me as a parent, because we see in Worcester Public Schools, particularly in my student school, where they take classes and they put them together instead of hiring substitutes. And I have seen this multiple times within my children's school. And so you have classrooms of 30 plus or more children, which cannot happen with COVID. So my question is, do you have enough quality substitutes? Additionally, it is not being addressed that you will have teachers who cannot come back to work because they themselves have students who are within school. So they're either elementary or and teachers can't come back. So we need to have other teachers or substitutes available, and that's something that was not addressed by you, Ms. Green. And lastly, the HVAC systems and updates, I guess I'm concerned about that as well. Thank you for taking my questions and comments.
Thank you. Were you having substitutes?
Sure. Let's see. The first question was, this is a preliminary meeting, and we will be talking to teachers about this as preliminary, and was no disrespect to the staff, but there were things that we had to do first, and what we did first is now done, and now they will be added on as we improve on the plan. I'll let Mr. Allen talk about cleaning the classrooms, HVAC in a minute, but I want to talk about substitutes. So we've always had trouble getting substitutes in the Worcester Public Schools in the best of times. So when I say there'll be no substitutes, there'll be no people coming from outside into substitute. First of all, that itself would be exposing kids to somebody from the outside. So principals would be using the resources they already have in their school. So we would never put two classrooms together or move kids to the back of a classroom. As you know, we have to keep with certain numbers, with social distancing, 6 feet apart. And so we wouldn't be doing that, but we would be very creative in our use of our instructional assistants and our other school personnel that are in our building to do the substitution. And then I think you said something about teachers that could not come back because they had their own children. That case, we're still expecting those teachers to come back to work and to arrange daycare. And Mr.
Okay.
You want to talk about cleaning the classroom and HVAC?
Certainly, Mr. Chairman. So in terms of cleaning the classroom, just like the other committees, we're developing the specific plans, but generally speaking, custodians will be cleaning high-touch surfaces throughout the day, and we're working on plans on deep clean disinfecting of schools on a as-needed basis, daily, during cohort switch of students and so forth. So working out those plans. With regards to HVAC systems, we're in the process of replacing all of our filters, in upgrading our filters to a higher grade filter based on recommendations from HVAC consultants, and doing work to optimize fresh air intake within those systems. Again, we are working on a full HVAC report based on the request of the school committee, and that will be forwarded once that is completed.
Okay. Karen, I've glad you talked. Please say your full name and city, please.
Hi, I'm Karen Bodemer, from Charlton. I had a few questions. The data that you gave regarding the masks and the numbers for the masks, I'm going to make an assumption that was for both staff and students. And that number works out to less than 2 pairs of gloves per week per teacher. I'm just wondering how we are expected to use the same gloves every day, number one. Number two, teachers are really great at collecting data and looking at research and know that it needs to be robust. I think we can all safely say that the anecdotal data on camps and other countries and very small samples that DESE and some others are using to justify being in schools is inadequate at best. And I'm concerned about the data being data that we can rely on. Number three, obviously the HVAC concerns. Again, there isn't any data that can tell us in a safe way how that many students in a classroom, even if it's only 15, if that is a reasonable expectation for transmission. The data has said otherwise. And I also think that as leaders, we need to lead by example, and that the leadership in the city and school system must be required, in fact, I'm sorry to be so forward, but must be required to meet in person for a 6 or 7 hour day with masks, with 2 non-masked meals and mask breaks, and tell me if you feel safe. I think it's disingenuous for us to be expected to go back to school when the leaders that are making those decisions aren't doing that either. And it concerns me. And lastly, in terms of social emotional needs, how many students and staff die in a typical school year without a pandemic? And think about the trauma teams and the resources that are provided to those schools for many days afterward. I have had the unfortunate experience of that in the Worcester Public Schools. It is awful and it impacts everyone. We are going to live that times I don't know how many. And I'm just not sure that that social emotional damage and trauma is worth it. Thank you for taking my information. Oh, one last thing. We have 6 weeks to decide all this. We have been left with 6 weeks. That concerns me greatly, and my voice is only being heard on July 20th. Thank you.
So Karen, my response to that is that we still don't have a lot of the guidelines that we've been waiting for, such as transportation. So we have been working every single day and night and weekend to figure this out, as you can see by the quality of the presentation that we presented tonight. And even with that, this is preliminary. So the focus of today's presentation is to get the information out to everybody so they know what we're thinking about. So as far as, the death of a student or a faculty member. I've been through that myself. And yes, we do have really great SIS teams that come in and help us. And it is it's terrible to go through that. And we don't want ever to go through that again with one staff member or one student. However, we are just following the guidelines that we've been given by Department of Elementary and Secondary Education. And we're presenting the plans as it was directed for us to present. And then with the feedback like you've given to us, which, you know, was very passionate, and I'm sure many people, as you know, share what you said to us today. We still want to give parent choice on this. So parents still have the right to choose a hybrid or the remote learning model.
Maureen, if I may, I also want to assure all teachers in the public schools and staff that nobody will be shortchanged any personal protective equipment. That is one of the reasons why we have a COVID-19 person in each of the school buildings, so we can plan accordingly that we don't fall short of making sure all staff get what they need to protect themselves and others. So the numbers that you saw tonight was one illustration of what we're ordering, the volume of it, but we have various budgets that we're ordering all other sorts of PPE for all staff in the school system.
Thank you. Bob, our next question.
Yep, we've got Heather. Heather, if you'd unmute yourself, state your full name and city.
Hi, my name's Heather Olvez. I'm a parent of a second grader in Worcester, Mass. I have a lot of concerns. One is that it keeps being addressed as a choice if you continue to go full remote. But in my family, where I'm my breadwinner, I pay my mortgage, I pay my bills. I am high risk. I have diabetes and asthma. I also have my mother, who is taking care of my 94-year-old grandmother. They're both diabetic, they're both high risk, and even though I don't live with them, I support them. So if I get sick and I have to come into their home, or I'm asymptomatic, I may take out my mother and now be responsible for a 94-year-old in my home. It's not an option to me, it's not a choice. We have to do remote, or this could take out 3 generations of my family. Things that concern me is hearing that 3 feet of distance is being recommended when the CDC is saying this is airborne. 6 feet may not be sufficient, and now we're looking at possibly 3 for our children. How are these transitions going to happen? I see kids line up for school every morning. Is somebody going to be out there ensuring kids stay 3 feet apart and have their mask on before they get in line? The day starts and ends long before and after the school hours. These kids now have to walk home with parents who don't believe that there is a pandemic. They don't believe in masks. I see it in the grocery stores. I see it when I have to leave my house. We'll be doing remote. And what concerns me is there's teachers on here who are also high risk saying, well, can I teach remotely from home? And you're saying, no, you can take 12 weeks of leave. I would appreciate them working from home and teaching my second grader, who now is only going to get 1 day of time with their teacher. It's going to have to be 4 straight days of me doing teaching with my son, which, by the way, I work from home. I have to be in my bedroom with the door shut for 8 hours or more because I'm salary. My day doesn't end at 5 o'clock either. I have my boyfriend who works until 12, 1 o'clock at night. He's got to get to sleep. Now he has to wake up exactly at 8 o'clock to get my son ready for school. It's not a great model. Why can't it be pre-recorded classes then? Teach them piece by piece their teacher and give them more time, FaceTime with them. If you have teachers available who want to work from home, make them accessible to the children who need to be home.
So Heather, we're still working on that model. However, because we do have an in-person model, we have to make sure that we have enough teachers that are in there to be able to teach the students on the in-person model. So the in-person and the remote come in, work together. It also helps with lesson planning so that they can provide more coordinated service for our students. So our number one focus here is what are we going to provide that's best for our students. That's where, a school district, That's what our job is, right? Is to provide for our students. And we also care about our staff and want to make sure that they also feel safe. And so we're making our schools safe, and we're providing PPEs for them. And then for those that staff that, you know, just can't come back because they have some type of risk, there are options available for those staff. So we, you know, right now, what we've been doing is looking at how will we staff, you know, running a hybrid model and a remote. Because there's a remote with the hybrid, but there's also full remote. So that's some of the work that we're working on. But we just have to make sure that we have staff that can do what we really want to do for all students.
Okay, thank you. Bob, next question.
Yep, sure. I'm going to mispronounce your name, Zinab. Could state your full name and city.
Hi, hello. My name is Zainab Lefri. I live in Worcester. I am a parent of 2, and I am also employed with the Worcester schools. I had a question regarding, I'm an IA. I had a question regarding the groupings. My son will be in Group C. He's a 3rd grader in the SEAL program. My daughter was Group A, and I teach, I'm an IA at South for Group C's and B. How will that work if everyone in my household is on a different schedule?
Maureen, I think she tried to explain that earlier, but Maureen, you want still?
So, so Group C right now is meeting 4 days a week. So they're going to be meeting all 4 days. Group A would meet only on, we got in person Monday and Tuesday, and be remote the other 3 days. And so, and your schedule at South would be that you be there 4 days a week. So for the child that has remote, you have to arrange daycare for that child.
Okay.
Okay. I've got Cynthia next. Cynthia, if you could state your full name and city, please.
Hi, yes, I'm Cynthia C. Lansing from Leicester, Mass, and I work for the public school. Work for the bus company, and I have a question with the way, because I do the special ed. There's 8 to 9 seats, and they're saying 8 students on the bus. The bus from my back seat to the end is 12 feet long, and it's less than 12 feet long and less than 7 feet wide. What if there's a student that needs a nurse with him or an aide with him? What about a monitor? And if you're doing it the way you're going to say you're going to do it, you got kids diagonally across from each other, and they're going to turn around and look at each other, and who knows what they're going to do.
Okay. Brian, you have anything on that? Or?
Mr. Mayor, this is something that we've been discussing with the DAW, this exact measurement issue. So we continue to discuss with the DAW for negotiations.
Okay. Thank you. Bob, our next question.
All right, we've got Becky Harvey. Becky, if you could please state your full name and city, please.
Becky Harvey, Oxford. I teach in Worcester, and I have high risk, more than one condition, and I'm absolutely terrified to go back to school, but I'm not in a position with money to be able to say that I'm going to take 12 weeks at, what is it, 2/3 pay or whatever it is. So I'm basically going to have to go into school and hope for the best. So this is probably a question for Rob Pizzella, the first part. What I'm wondering is what extra precautions will be handed out? Like, will we have any kind of plexiglass barrier put in place so that we don't have to worry about, you know, it's like you go into the supermarket or Walmart or wherever, they all have plexiglass keeping them safer. Will we have, if we're at risk and have a doctor's note, can we get something extra like that? So that's one question. The other is, or if we're doing online classes as well as our in-class, number one, will there be a tendency to kind of make the kids come into the class because they absolutely flat out refused. I had some of my best students last year saying, it doesn't count, I'm not being graded. And I understand they're being graded now, but without attendance requirements, I don't think they'll show up to an online class. And also, will there be any kind of monitoring software for Chromebooks? I'm assuming that since we're one-to-one and we're trying to not have them touch much stuff, they'll be bringing their Chromebooks around in class and using those for all of the non-paper type things. Will we have monitoring software to make sure that they're not misusing their Chromebooks? And finally, I understand that we are doing like teaching some days, and then the kids who aren't in the class at the time are doing things online. And we're supposed to, from what I understand, create a lesson for that, or I'm not really sure. I don't understand how we're doing both 4 days of in-school instruction plus 4 days of online instruction and the 1 day of just online. I get that, that's easy. But, so anyways, first to Rob, are we gonna have anything extra for people who are at risk, who can't afford to take the time off?
Rob?
Thank you, Mayor. Any teacher that has a compromising medical situation and is reporting to work, they will definitely get additional protection, whether it be additional personal protective equipment. We are building portable screen guards where a teacher can take these plexiglass stations, we call them screen guards, and that could protect them further from whoever they're talking to, whether it be teaching to students or talking to parents or talking to the public. So yes, we will definitely assess any situation, whether there's a medical situation with a teacher or a staff member and they need extra precaution.
Okay, Maureen?
So I think the question was about students not coming into Google Classroom. So we'll make it very clear to students that Google Classroom is expected. Every teacher will be having a Google Classroom. And I do think the fact that we didn't do grading, as was the DESE guidelines in the spring, that did affect the attendance of students in the classroom. We will be taking attendance in the classroom, so we will be keeping track of students' attendance. Now, how that's going to be reported to DESE and what the expectation will be from DESE, I don't know. What was the other thing I wrote down? The other question. Attendance taken. Can't read my own writing at this point in time there. What was the last question?
It had to do with the Chromebooks.
Oh, Chromebooks. Chromebooks. That's what that says. So we have not purchased any software, or I guess it's software at this point. But that's something that we could look into pricing if that is a concern.
Okay,
So,
thank you.
I could just jump in there really quickly. In terms of, I don't want people to think these Chromebooks at our home are unfiltered. We do filter them. I know monitoring software is a little different, but in terms of filtering, they are filtered.
Okay.
All right.
Okay.
Yep. The next person we've got is Jennifer. Jennifer, if you could state your full name and city, please.
Hi, Jennifer Felicity. I live in Douglas, but I work in Worcester Public Schools. I have sort of a pragmatic question. If we do hybrid, I'm wondering, what about the sample textbooks? Typically, we may have 30 textbooks per teacher, but I might actually have 30 times 5 students. So are we suddenly coming up with a massive budget where we can supply a textbook for every single student? And in addition to the textbooks, let's also think about scissors, glue sticks, colored pencils, rulers, etc. So I'll keep it really simple and keep it to just that question. What sort of plan is being made for something of that sort?
So Jennifer, a lot of our textbooks have some online component where students have access to the textbooks. So I'm not sure what level that you're talking about. I'm gathering it might be middle or high school from what you say. And so that would be, you know, and we did order online textbooks in the spring going forward this year, because we were preparing for possibility of having to do that online work. Students though will be, you know, your person-to-person hybrid model will be in school with you 2 days a week. And something that we didn't mention about that model is that students will then get lunches so if they're an A group, they're in school Monday and Tuesday, they will get lunch and breakfast to bring home with them for Wednesday, Thursday, and Friday. And for the other groups also, that there are Wednesday and Thursday, they'll get breakfast and lunch to bring home for Friday, Monday, and Tuesday. So one of the strengths of the person-to-person learning is that when students leave your classroom, they can have a bag of some extra supplies they may need in order to do their projects. That is a strength of that particular model. And but you do give us thought about the full remote and how we get students access to the same supplies. So that's something we will note.
All right, we've got Michelle. I'm gonna allow you to talk. Please unmute yourself and state your full name and city, please.
Hi, my name is Michelle Tufo and I live in Worcester. This year I will have 3 children, a 7th grader, an 8th grader at Forest Grove and 1 at Worcester Arts Magnet. My question actually, was for the mayor, who doesn't seem to be on, but my concern, I worked in higher education in the city of Worcester, and we moved our college online, as everyone did, and we have had significant issues with connectivity. And I'm not really sure, but I'm worried about the infrastructure of the city of Worcester as everyone is moving to this online format. Even in this meeting today, we've had issues with the internet. So if someone could speak to like what's up with the Wi-Fi and what are the plans to reinforce that, that would be great.
Yeah, this is a major priority. Maury, you can jump into. We've been discussing this internally over the last several months, and it's a big issue. We sent a letter to Charter Communications today, signed by myself and Maureen, and asking that they provide the right connectivity to our students and to the businesses here in the city of Worcester. To me, it's an equitable issue and issue of equity, and so we're ready to push that. I know we have enough connectivity until the end of August for the summer school programs, but we do not have that for the fall. So, although I think Senator Chan was just trying to get extra money into the budget for our connectivity payments, that we can make that payment. The issue of Charter is that they don't want to have a one single payer system that's affordable to our students. And so this is something we're going to be addressing over the next few months. There was a report you might be interested in. Look at the Worcester Regional Research Bureau and look at their report they just came out with about the future of trying to make sure we have good connectivity here in the city of Worcester. But it's a major issue, and it's not just us, but we are going to address it. Maureen, did I miss anything? Or
just that we did purchase 5,000 hotspots, and
for the summer, though.
For the summer, and they're good until August 30th. In the CARES Act money, we put $1 million in there so that we could have them again activated for those 5,000 hotspots for the rest of the school year, which actually came to $750,000 under the CARES Act money, which left us some extra money in case we have to purchase more hotspots. But we know from a conversation with Verizon this week that all over the country, school districts are looking for hotspots, and they were giving us a let up to let us know that it's becoming a very needed commodity. So we do have 5,000, and if we needed to purchase more, we saved some funding for that. The question will be, will they be able to get them? So our plan is, we know we've already passed hotspots out to families that already told us they needed them. In our recent survey that closed today, the numbers are around 36 families that still need hotspots, and we won't be able to accommodate that. So we have a backup plan if charter doesn't come through, which would be our first choice because that stronger a broadband, that would be our first choice. But if not, we have purchased those 5,000 Chromebooks, and we have put in for connectivity 5,000 hotspots, and we put in.
Right, and there's also access issues, I understand that, whether it be physical barriers throughout the city, regardless of charter, so that's something that's gonna be addressed too, so. Okay, thank you.
All right.
Good question, Bob.
Yep, we've got, looks like Jen. Jen, if you could unmute yourself, state your name and city, please.
Sure, thanks. Thanks for taking the question. My name is Jennifer Edward, and I'm a Worcester resident. My daughter will be a first grader at the Roosevelt Elementary School this school year. She currently participates in the dual language program. And my husband and I haven't yet decided whether or not we'll be sending her to school or if she'll do remote. She would be a member of Group A. So I would assume that some of her school time would be dedicated to Spanish learning. My understanding is that for the program is that you learn 50% in English and 50% in Spanish. And as we're all aware, it's understood that there's an additional level of teaching at home required by parents. And I am totally committed to doing whatever it takes to make sure that she's set up for success. However, we're a non-Spanish speaking home. So I'm wondering if there are any plans to modify the lessons to ensure that the students are getting the full experience. And I'm not sure how different the remote learning plan will be as compared to whatever the plan will be if they're participating in the hybrid program. Just a note, I attended the open house prior to her being in kindergarten last year for the open house, and it was so amazing to see how these children, some of which came from non-Spanish speaking homes, went in with no experience at all. They didn't speak it at home, but these kids came out in 6th grade speaking fluently. It was just amazing to see, right? So those are my hopes and aspirations for my daughter, and hopefully my son when he's old enough. And we all know it's much easier to teach math and English and English language, but it's a bit more challenging to teach Spanish and to teach it correctly when you don't speak that language. So I was just wondering what considerations were made for that, if the program would be modified in any way to make sure that everybody's on the same page, and how they would move forward progressively, grade by grade, to make sure that they were, set up for success for the entirety of the program.
Maureen?
Well, first of all, I'm very excited that you're going to be in the dual language program. We actually had 80 applications for, those small number of spots that we had. And we're hoping that we can expand the dual language program. So your excitement about it is the same as our excitement about it. And I'm going to ask Carmen Melendez, who is our L director, to answer your question more, a little more detail than I could.
Hello. Thank you for your question. I'm glad you asked. I was hoping that someone would ask a question about the dual language programs. We're very excited about the upcoming year, actually, regardless of the different things that we are considering and that we are trying to figure out for schooling. We just bought a new set of curriculum materials for our dual language program. It's the American Reading Company, and it has many virtual resources for families, both in English and Spanish, that I think you'll find very useful and resourceful while your child learns, whether remotely or in a hybrid model. We're actually planning 2 sessions as part of our initiative to provide training and webinars for our families. We're preparing 2 webinars specifically for dual language families, one in English and one in Spanish, to share resources and to engaging in conversation around collaboration and how can we support you if English or Spanish is not your dominant language. We also last year hired 2 bilingual interventionists for both of our programs. And one of their main role is to support those students that are learning Spanish as a second language and to support families. So one of their roles is not only to support children that are learning Spanish as a second language, but also to support families with continuous opportunity for collaboration and learning together, but also to share resources that will help you as a parent support that child learn another language that you may not know or feel confident about. So we are also providing, like I mentioned, we just bought this new set of curriculum materials, and we are in the summer providing a lot of training for our teachers around those to ensure that whatever they put forward will be a good implementation and that parents are aware and informed throughout the entire process.
Okay, thank you.
Mr. Chair, can I just
Sure.
make one comment to that as a parent? I think
Yes,
that
you
actually
can.
probably one of the students that you heard actually was probably my daughter, who's been in the dual language program since kindergarten. She's a rising ninth grader. And I just wanted to add to what Carmen just said. She was actually in the summer program that just finished a week or so ago that was for the dual language students who were continuing. And I have to say that one of my concerns was actually, we're a entirely English-speaking family. She's been doing half-time Spanish since kindergarten. And one of my concerns from the remote learning was that she was losing her spoken Spanish. And I was very impressed at how much the summer program was emphasizing that. So I was encouraged by that sort of switch that had happened. So I will say, first of all, that you've got a couple of eyes here on the committee watching for that, but also that it's clear to me that the department actually was paying attention to that as a concern. Thanks, Mr. Chair.
Okay. Thank you. Okay, Barbara, next question.
All right, we have Kirsten. I am allowing you to talk. You got to unmute yourself. Give me your full name and your city, please. I'm asking her to unmute. All right, I'll come back to her.
Yeah, she's been waiting for 3 hours, so you might want to come back.
All right, let's see. Is it Deborah? Deborah, if you could unmute yourself and give your full name and city of residence. Here she comes. Deborah, go once. All right, Alyssa.
Hi, can you guys hear me?
Yes, we can. If you could state your full name and city, please.
So my name's Alyssa Betancourt. I live in Worcester. I'm actually a student. First, I just want to thank you guys for staying up this late to answer my crazy questions. But I'm pretty sure that I represent like most of my high school when I say that remote learning like completely was so detrimental to my like education. Like I definitely got dumber. And as well as to my siblings who both have IEPs and have been following them for most of their, Worcester Public School education. And so I'm just wondering if you guys have, firstly, if you guys plan to provide hands-on equipment / resources for those who do follow IEPs, because I know my youngest brother, Trevor, he attends Worcester Arts Magnet, definitely struggled. And I tried my best. It's just we don't have those resources and plans for that, as well as how you plan to accommodate those students whose parents now rely on them for childcare, because we will definitely be choosing remote learning option. So I was just wondering what you guys I obviously know we're getting graded now, so how you plan to deal with that.
I think we got that, Maureen. Did you get, cut out there a little bit. Did you get the question? No.
For some of them, I did. I think she said that they're planning on doing remote learning, and we're wondering about some of the resources, and also about the childcare or the childcare options. So if they're, if you're doing remote learning, that means that all the students will be at home full time. So teachers will be teaching, and there'll be some asynchronous work that will also be expected to be independently done. And as far as the daycare options, that's something that families have to arrange on their own. Though we are having some communication with community partners, it still would have to be an arrangement that would be with the family and the care provider.
Okay.
One of the things I want to say, though, also is that we're keeping siblings on the same schedule. So if they were thinking of a hybrid model, everybody would go to school, the same days, unless they're group C, then they're in school for 4 days. But if they're doing the second model, they would have the same days in school and the same days at remote. And in her case, since she's a high school student.
So I'm sorry to interrupt you, Ms. Beninda. I just don't want to waste your precious time. That's actually not what I was asking. So like, I'll give you an example. My mom works full time. She also attends school. So me and my oldest brother do help out to watch my youngest brother around the house. Especially now that, we're not in school. We weren't in school in the fall. I do work as well. So I was just wondering, like, mostly for me, like deadlines concerning like deadlines with assignments and stuff like that, if they would be a little more flexible, seeing as how I do have to, help out with my family and stuff like that. I do have other responsibilities.
Right. So listen, I mean, obviously, we have to understand with all the responsibilities that you're also working, you're taking care of siblings, parents working, and that's a communication that you would have, with your principal and your teachers, so that you're able to do all of those things and still be successful.
Okay. And my second question was if you guys were planning to provide like hands-on learning resources for those with IEPs, because that's a concern I have with my brothers.
Yes. So Alyssa, we absolutely are going to follow what is in the IEP, your brother's IEP. So we're providing the resources that are needed for your brother to be successful also.
Okay. All set?
Great. The next on the list is Angela. Oh, excuse me. Yeah, I'll do Angela. I'm sorry. And I'll come back to Tara. Hi, Angela. If you could unmute yourself and state your full name and city of residence. Oh, okay. She gets an older version of Zoom. 1 second. All right. Angela, go ahead.
Hello?
Yep, we can hear you now.
Hi. My name is Angela Ramona. This will be about my 16th year working for Worcester Public Schools at the elementary. I have one child in elementary level and one in middle school. Just being an elementary teacher, I wanted to bring up that typically when the school year begins, the classrooms are hot, and I bring my box fan and my standing fan, and if kids are hot, they can stand up and cool down. And I myself, when I go shopping, I wear my mask, and you can see the employees after a few hours tend to lift up the mask so they can breathe, and then they bring it back down when people walk by. I'm just wanted the school to consider the comfort of the students because the classrooms tend to get a little hot. And also another thing I was thinking is this year I had the opportunity to work as a tech teacher, and the classroom, when the classroom computers are buzzing, it's tough for the students to hear the teacher. So I actually had to purchase voice projection. So I think that it would be a good idea for us to have a trial run where maybe some staff members come in and sit the 6 hours with computers going and just kind of see what things might arise before we bring in the kids.
Okay.
So, Angela, we've thought of that, and thank you for bringing that up, especially with heat. We know that there are some hot days in September, and there are some guidelines regarding fans that we have to look at, because fans and blowing the virus around the classroom is something we want to look at also. So we're not sure about if we can use fans or not. So that's a good thing you brought that up. The other part of it is about water. You know, when we had those hot days 2 years ago in September, and we had to put water stations at every school. We're looking at how we can do that safely also using COVID guidance.
Okay.
Okay.
We've got Natochi.
Hi, good evening.
Hi. You can say your full name and city of residence, please.
Yeah, my name is Vera Okechukwu. I'm a Worcester resident, and I have a son that's going to first grade. My concern is for those doing the remote learning, most of us are worried that our kids can't concentrate or pay attention. So I was wondering if my son actually does pay attention. He actually does good on the online learning. But I was wondering if there's going to be like some testing after like each subject or after each course, so that we'll know like our kids, as in where they're not doing well and where we need to put like extra effort, and where we need to like communicate to the teachers on how we're going to like put an extra effort if like they're going to be tests, to know how good they are on each level, so that we'll know how to come in to help them more.
Okay.
So
Maureen.
the answer on that is the working group that we're working with now, adding the teachers, the parents, the students, and community members about assessment. So that's another big part of what we're working on right now. One, how to make remote learning rigorous and effective, and two, how to assess. So more information will be coming to you on that in the next few weeks.
Okay. Thank you,
Okay,
Bob.
I've got, yep, Deborah. You could unmute yourself and state your full name and city. I think we asked for Deborah earlier and didn't get a response. All right, I'm going to go on to Tara. Are you there, Tara? Or Laterno?
Yep, this is Tara Laterno. Can you hear me?
Yes, we can.
Yes.
You could say
Yeah.
sorry, say your name, but your city.
Yeah, I'm from Worcester, Mass, and I work in the school system also. I have 2 children. My son's at Roosevelt and my daughter's at Worcester Tech. And I just had a concern because she's going to be a senior at Worcester Tech. And I know as a graduate of the old Worcester Voc, you know, the trade is more hands-on learning. And I just know that, you know, I just feel like, will they be getting the fair amount of hands-on learning to prepare them for their trades, especially where she's a senior and she's supposed to go on co-op, which is an absolute help, because I know as being a graduate, I got a job right after high school going to co-op. I just felt like the analysis didn't really include Worcester Tech. So when can we expect the plan to be released for them, considering they have additional expectation for their trades? And if it is remote, where I have 2 kids and I also work in the school system, would I be able to be helping them? How's that going to work? I'm an IA. So there's kind of a multi-question in there. The big concerns about a senior year at Worcester Tech. I mean, trade is basically hands-on, and that co-op is important.
Maureen.
Yeah, I can answer that question. Chapter 74 program guidelines are coming out this week, and every vocational school in the state are waiting for this to come up so that we can figure out exactly how to do the shop week. As far as co-op goes, we're still planning on having those co-ops. The only challenge is going to be if the sites are not able because of COVID to take our students. So we're also exploring some virtual co-ops. I'm not sure what major is your daughter in?
Go ahead, Maureen.
Yeah, what major is your daughter in, Angela?
It was Tara, I think.
Tara,
We
yep.
Yeah.
Tara, you gotta unmute, Tara.
Oh, sorry. Yeah, I'm unmuted now, right? Can you hear me now?
Yep.
Yes,
you
Yep,
can.
she's in the veterinarian field, so it was hard doing online learning with the veterinarian part, you know what I mean? So I was having concerns about that, especially with some trade kids, you know, if they don't go to college, they go right out and work in the field. I mean, my daughter will be going to college, but she does need the trade experience. So I was just concerned. I know the trades are small too. They only allow 12 kids in the trade, so it'd be easy to social distance, especially if they go on co-op, correct? You think?
So,
I don't know.
you know, during part of the summer, the clinic still ran at Worcester Tech, the veterinary clinic. So, so we're working on trying to figure out how those co-ops can exist, because as you said, they're really important to the students, especially in the year, to get that direct experience on the job. So they could go on and become a vet tech or become a veterinarian. So we are, I just wanted you to know that we're on that, and the schedule for all the high schools in Worcester Tech actually will be on the same schedule. It's just how we're going to split up the classes so that both their related and chart classes and their academic classes, which tend to be larger, right? The academic classes, they're more like a regular high school, where their shop classes have smaller numbers, social distance. So we are working on that, and you don't have to worry about Worcester Tech. We will, again, as soon as we get the guidance in the next couple of weeks, also be posting that so that parents are well aware of the schedule and what the expectations are.
Okay. Thank
All
you.
right, we've got
Bob,
Marie.
Bob, we get
Yep, go ahead.
Bob, we get about 11 more people. We're going to end it after Deborah, I think, who's on there, or 11 o'clock, whatever comes first, give people a sense. So see where we are. I think we can get through to 11 though. So go ahead.
All right, Maria, you could unmute and give us your full name and city of residence, please.
Maria Ciavola. I live in Worcester, and I'm also a teacher here. First, I want to advise the council to look at the chat in the Facebook group, because loads of students and parents and educators have been on there, and there's some really good information that didn't necessarily come out in verbal questions. But I wanted to specifically talk about the physical plants of the buildings. I really want to be back in school. There are very few people that would argue with the fact that, you know, teaching and learning happens better when you can interact in person with your teachers, with your peers. There's little question about that. But I can't even imagine how I would feel if one of my students got sick and died, or one of my coworkers did. And I worry a lot about our aging buildings, right? Some of our schools are nice and new and have air conditioning and HVAC systems. Mr. Allen, you mentioned about replacing filters. Well, we have schools that are, you know, 100 years old, over 100 years old, 75 years old. They don't have ventilation systems. Our windows are ventilation systems, legitimately. I mean, I'm not making this up, it's a real thing. And they do get to be 95, 100 degrees at the beginning of the school year. So we're talking about the possibility of not using fans in rooms that are over 90 degrees with kids wearing masks, and staff too, obviously. People are gonna have to drink water. Masks are going to have to move in order for us to drink water. Kids aren't going to be allowed to go to the bubblers. They're shutting down the bubblers because it's not safe. You know, we want to be back in school, but we want it to be safe. And does the school department have a plan for putting ventilation systems in place in these schools that don't have it? A lot of our buildings are aging. You know, is that part of the plan? Is that part of the budget? How are you going to deal with the students who happen to go to those schools and the staff who happen to teach in those schools? Thank you.
Hi, Maria. Nice to see you. I just want to say, you know, several school committee members have brought up those, you know, those questions. Both Diana and Tracy in particular have been asking, you know, those questions regarding the HVAC and what's happening with the structure of the schoolroom itself. All the school committee members have been asking that. And those are the things that we're looking at also. And again, the group of teachers that are going to be on the committee, I'm sure, are going to be having those questions also. And I just want you to know and everybody else to know that, you know, we're looking at making the classroom and the schoolhouse as safe as possible with ordering all the supplies and also making sure that the students and the staff follow the guidelines that are going to be set the whole time that they're in school. Now, we know that, you know, students like to hug each other and, you know, get close together and talk close together. And those are a new way of social work that's going to be happening to be in schools now, where that's not going to, you know, we're going to be encouraging that not to happen. So it's going to be a retraining for all of us, including the teachers and the students.
Yeah, I think Mr. Allen's going to come out with a report, I think, hopefully next month regarding HVAC systems too, so you mentioned earlier. Okay, Bob, my next question.
All right, Anthony Sullivan, would you please unmute and state your name and your city of residence, please? Anthony? All right.
On to our next one, Bob.
Yep. All right, Trinity, please unmute yourself and state your name and city residence.
My name's Trinity Graham, and I'm a student at Doherty. So I'm about to be a senior, and I'm expecting, and it's just very difficult to continue on days not knowing what's going to happen with school. I honestly don't feel like being a guinea pig and going into school and having to wear a mask all day, because that's just overwhelming. I can't go in Walmart for like over 15 minutes with a mask on. Also,
Oh, I think we lost Trinity. Bob, will we lose?
Trinity, unmute yourself. There you go. Sorry, I thought you were done and I muted you. Go ahead, Trinity.
I don't feel that high school, I don't feel like bathrooms will be kept clean, because schools can barely keep the toilet paper stocked or soap stocked, the sinks and toilets unclogged. How am I going to believe that they will keep, they'll keep it sanitized for at least one person to go in and come out? Also, if we do go back onto remote learning, teacher communication was just terrible, and the grading was terrible. I know it was last minute, but the communication for teachers, you would email a teacher and would not hear back for weeks on end, no matter how many times you email. And that would be tough because the grades mattered, and I know that the grades were just numbers, which also messed a lot of things up, because then it was hard to know what I still didn't turn in, what I needed to turn in, how I turned it in. It was just stressful overall, and it was just my opinion right there.
Thank you for your opinion. Oh, Maureen.
If you are going to have to wear a mask, That is a requirement that every teacher and every student wear a mask. So if you decide you're going to do the hybrid model, so even for myself, I'm comfortable with the mask, and what I've been doing is wearing it so many hours a day, so that when we're back at work full time, we'll be able to use it. I suggest that you try that also, because the mask is to protect other people as well as yourself. And we are going to say everybody in the high school has to wear masks. And I'm not talking about the severe special ed students, but I'm talking about every student in the high school that's in the regular class is going to have to wear masks. As far as the remote learning, yes, we know that we had to make changes on that, and the remote learning is going to be different. First of all, you're going to receive grades for the work that you do, and your teachers will be monitoring your work, and you will have that one-to-one touch point 2 days a week or 1 day a week, depending upon what model that we use in person, that will support your learning. So I know everybody is nervous about it, but it's important that if you decide to do hybrid, that you come ready to go to school and ready to do the work. Because as you said, it's your senior year, and you want to have the best senior year possible.
Okay.
Back to the mask thing though. I honestly know that as a high schooler, not all high school students will keep their mask on for the required time. I know that they will not keep their 6 feet, 3 feet, however many feet away. So how am I supposed to go to school safely knowing that people around me aren't safe?
Well, Trinity, we're hoping that, that you'll get the word out and you'll tell your friends, and we're also doing social media and having conversations with students and with parents so that everybody understands the same expectations. So it'll be important that you help us do that work also, so that everybody knows that we need to protect everybody while they're in school.
Thank you, Trinity. And, okay, our next question, Bob.
We've got Tina. Tina, if you could unmute yourself and state your city and your full name, please.
Good evening. This is Tina Puglisi-Savage. I'm a teacher over at Worcester Arts Magnet, and I'm here by computer and by phone because I've lost you 3 times.
All right, Tina,
I have, first of all, to commend everybody for the passion and concern that we have for the kids. And I am a high-risk person, being highly anemic and asthmatic. I'm a high-risk person, and I, at the same time, have nothing but a desire to get back into the classroom if it's safe. I've wondered if any consideration was given. I know we can't do live stream because people cannot see other people's children, but if we did a remote hybrid model that incorporated kids keeping their cameras off, or us in small pod units where approval was given between families, I wonder if that was considered. Another question was that Mr. Pizzella said that we would be doing contact tracing. Right now in the news, we're hearing that contact tracing is going to be defunded. Another concern was if families have multiple children, like in different schools, will schools be privy to information school to school, and who will be able to let other schools know that there is a child from that particular family that is testing positive. That was another concern. As a teacher, I'm concerned about Zoom etiquette and the fact that during Zooms I had kids sleeping, I had kids bringing pets, kids left alone on Zoom, and we made sure as a staff that no teacher was left alone with a group of children in a Zoom room. The specialists and aides and vice principal and principal were diligent about supporting teacher to teacher, so that a teacher shares a screen and you can't see the other children, that the children are safe. That's a concern. Myself having poor internet connection is a concern. Can faculty get a hotspot? And who will make the final decision as to what model we use? And is the district at this time leaning towards a particular model? And then the last thing I wanted to say was Alyssa Bedencourt is a product of Worcester Arts Magnet School. And I'm proud that she called in as one of her teachers. As her arts block teacher, I had her from pre-K to grade 6, meaning I see kids for 7 years grow and learn. And she was articulate. I know both her brothers. I know their family situation. I can tell you that they are supported by our WAMS community, but I was very proud of her for calling in. So thank you. I'll hang up because I don't even know if I'm echoing right now because I'm on both places. Thank you.
You're echoing a little bit, but we got it. Maureen?
So I'm going to answer the ones that I can answer, and then I'm going to have Sarah answer the ones that have to talk about Zoom and protections for that. So the question you asked was, one of the questions, like, do we have one model that we like more than another? If we have 6 feet and we can also do transportation, the model that I like is the hybrid model. I'm talking about which hybrid model, because there'd be touch points with students twice every single week, directly in front of their teacher. So that's the model that I would prefer for the hybrid model, just because it's more interaction with teachers. But we have to put together a report on week that recommends one hybrid model and also remote learning full-time model. So that's why we're having these discussions, Tina, so that we can be informed of what our parents want, what our teachers want, what our community wants. So we have not decided on that, and school committee have a very important role in this also. And so we will be presenting a report. We have to have a commissioner on July 31st, and then we'll get that back from the commissioner sometime before August 10th, and then we will be sharing that with the community. Once that's approved, we have to have everything posted and up and available to the community. So that's where we are on that. I would say that the school committee, the district, and the commissioner of ed are the 3 main parts to deciding on what plan goes forward based on the feedback that we've gotten from everybody that's been calling tonight and will be calling on Wednesday night.
The other question was, if someone has kids in 3 different schools, Maureen, what was that one?
So the question, so we are putting people in cohorts. So if you have your children in 3 different schools, they would be on the same schedule.
And if one comes down with COVID-19, would communicate to the rest of the schools, I would guess.
So we have to follow the HIPAA law on that and the recommendations from the state. So
Okay.
It would not be something that we would be spreading to all the other schools. We have to follow guidelines in the HIPAA law regarding that.
If I could just briefly say something there, I'm not aware of the Department of Public Health in Worcester cutting back on their contact tracing program. So whenever anybody tests positive, whether it's a child or an adult, there is a process they put in place along with us, working collaboratively with us, to notify the surrounding people who might have been exposed to COVID-19, in addition to working with the infected person. There has been no cutback that I'm aware of.
Okay. And the other question, Maureen, was if the teacher has poor internet connection, not to the fault of their own, can we be helpful?
So right now, we only purchased the hotspots for our students.
Yeah.
So I would say that teachers should probably purchase, hotspot or check to see why their The cable's not great at this point. We're not planning on purchasing hotspots for teachers. However, we did purchase better Chromebooks for staff so that they're able, the ones that they currently have, students were saying that the Zooms would go down and the teacher would have to get back in the classroom. So we have purchased updated Chromebooks for staff.
Okay. Okay, Bob, next question, Bob?
I think Sarah had a question. Didn't she want, wasn't there a question about Zoom?
Oh, the Zoom etiquette. Zoom etiquette.
Yes, Sarah has the answer to the rest of that.
So we do have some guidelines and in a lot of our training for Zoom etiquette for both staff and also students. Some of the points that were raised about bringing pets in, actually some teachers encouraged the use of bringing a pet in. Some teachers brought pets in and said that students really liked that. When we did one of our surveys, students commented on the pet. So I think it's really up to the individual teacher to build a classroom community and those best practices and culture around, you know, being respectful and seeing what works and what doesn't. So as far as, you know, eliminating pets or something like that, I wouldn't feel comfortable saying something like that. But I think it's really finding what works for you and your students so that everyone has a respectful culture online. I think,
Okay.
I don't know if there was a particular question around Zoom, but we do work with teachers on that.
Okay.
All right.
Bob, my next question.
I've got Sarah. Sarah, if you would unmute yourself and state your full name and residence. City of residence.
Hi, my name is Sarah LaPrade. I'm a Worcester resident. Can you hear me?
Yes, we can.
Okay, very good. I am a single mother. I have two children entering Tatnick Magnet. One is going into the first grade. The other one is entering preschool this year. I happen to be a director for like a $3.5 million operation, and I've been essential since the beginning of the pandemic. My kids do go to full-time daycare, and I just feel like the remote aspect of the hybrid is a little biased towards people in my situation, meaning we're not going to be able to hit those, you know, those deadlines during the day by like a day-by-day basis. My kids don't get out of daycare until 5:30. I work 12-hour days. I have two kids. I have to clean. I'm the primary caregiver. I'm also the breadwinner, and I pay all my bills. I cannot quit my job. I cannot lose my job. And if we're being forced into remote learning, there needs to be a model for the working people, especially single parents, because we're all they have. There is no buffer. Daycare will not do remote learning. They just don't do that. And seeing as I pay like a mortgage payment for daycare, I can't afford a tutor. So that's my first question, is if we could get like a different model to go by, like maybe like a weekly, because I have weekends off. I can do weekly, or I could meet with a teacher at 5:30, but that's not in your contract. But it's not my contract to be leaving every day early due to COVID. That's not going to fly. My second question is for the preschool. Is that going to be a full day now, or is that still a 3.5 hour day?
Maureen?
Thank you.
Oh, I'm sorry. I didn't mean to cut you off. Go ahead.
Oh, no, that's all. Thank you very much.
Yeah,
Thank you.
Sarah, I wrote you an email back on this question yesterday, I think. And basically, we don't have a model that's not going to have remote learning in it. And so, you know, as difficult as it is, the only answer is that parents are going to have to, you know, seek daycare. You know, maybe a group of parents get together and the kids are at the same house or something like that. There's nothing really that we could offer that does not have remote learning in it. So there's the hybrid and full remote, and that's all that we could offer for that. There really isn't any other model. And what was
the preschool, Maureen, is preschool 3.5 hours versus full time?
Yeah, the preschool is. So is this preschool West Tatnick that you were talking about?
I think she said Tatting Magnet. I'm not sure.
Was it
I thought she said Tatting Magnet.
Tatnick Magnet has a full day preschool. I'm just not sure. I think Yvonne is on here. Both of those preschools this year are going to be full time. Is that right, Yvonne?
I don't know if Yvonne is on the panel, is in the panel, so.
Oh, maybe she can't get on.
Sorry, maybe.
Tatnick Magnet. So here she
Hold
is.
on.
Oh, Tatnick Magnet. I'm thinking of Chandler Magnet. Tatnick Magnet has halftime, 2.5 hours.
Okay, yeah, that's where the question was. It could be full-time.
Tatnick Magnet, no, it's 2.5 hours.
Okay. You know, and these are challenges we're going to have. We understand more than ever these parents who are single parents who work during the day and that plan's not coming out to August 10th, and the pressure you're under, we feel it, and we're going to try to address them as much as we can. So, Bob, our next question.
Yep, here, 1 second. All right, I'm not going to be able to pronounce his name. I'm going to Kasaya Ali.
You did pretty good there, I think.
Yeah, well, we'll find out. Could you unmute yourself and give us your name and your city of residence? Oh, you hung on this long. Come on.
I think they're muted. Yeah, they're muted right now.
I can ask and unmute, but I can't unmute them.
Why don't you go down to the next? We can go back to that. We'll go back.
Yep.
Stasia Zogby.
Hi, can you hear me? Hi, I'm Stacia.
Yes.
I'm from Worcester, Mass, and I am actually a student at Worcester Tech. I know maybe this question has been asked, but I don't really have a clear understanding yet. So how are we going to ensure that students are given work to meet their academic level? You know, during the spring remote learning, we were given a theme for all academic levels, and you know, that didn't really help. We saw the survey results from earlier, and I can agree that we didn't really get, we didn't really understand, we didn't really learn, and it just felt like busy work. So how can we ensure that students are given work that meet their academic levels? And to also go along with that, how can we ensure that students are effectively communicating with their teachers during like the hybrid programs? You know, while teachers are teaching a full class to students, how can they ensure that, you know, they're answering students' questions through email or Google Hangouts or something like that? So how can we make sure that that gets done?
Those are two good questions, Maureen.
Yeah, so Stacy, I was just wondering, I know during the first remote learning, that's when the packets were done, but what about the second remote learning plus, where teachers were teaching lessons and communicating with students? I'm just wondering, is that effective, that part of remote learning?
I could say it was a little bit more effective because, you know, I go to Worcester Tech, so I have my trade. So in that aspect, it did help a little bit, but, you know, I had no contact with my teachers whatsoever. Once we switched over off from themed to individual, it didn't really help the students out as much for what I could say. It was kind of more just busy work, and some teachers still had implemented.
So the lessons learned that we definitely want to continue with is to have that contact with the teacher occur more regularly. So if it's in a hybrid model, and let's just say it will be go to school, say you're in group A, you go to school Monday and Tuesday, Wednesday, Thursday, and Friday is remote. And so there might be a video in the morning that your teacher has already pre-posted. You would have to view it and do some independent work. And there'd be check-ins that would happen on those remote days. So the difference, of course, is that you're going to be able to see your teachers 2 days a week. And I think that will help with making sure that the work is rigorous and checking in on those students that might need extra help, or providing extra work for those students that really want to be challenged. So the remote learning will be very different than what you experienced during last spring. And I don't know if you were involved in the summer school program, but we did learn a lot from that, and we want to copy what we learned that was successful for the remote plan going forward.
Very good. Thank you.
Yeah.
Stacy, thank you. Okay, going on to the next one. Is it Kristen, maybe?
Yep, Kristen. Hold on, I gotta promote her to a panelist. A second. Kristen, can you unmute yourself?
Christian Kamara, I think it was.
Yep.
You still see
Go
it,
ahead.
Bob?
Yep. Kristen Kamara, could you unmute yourself and state your full name and city?
Yes, can you hear me?
Yes.
Okay,
Yes.
thank you. My name is Kirsten Kamara, and I live in Worcester. My first question would be, I have twins that are in Roosevelt right now, and one is on an IEP and one is not, but they're both in second grade. Would they both be going on the same day? Going into
Maureen?
So that would depend upon, is the student that has the IEP also included in regular classes? Then they would be going in the same day. If the student is in a self-contained classroom, then the student would be going 4 days a week. So
Okay.
those days would be the same, right? Yes.
Any more questions? Kristen?
Yeah, I have one more question.
Sure.
Okay, if now I have another question. If I put my kids into the hybrid model of going to school, and in a month or so I decide that I would rather do remote learning, could I take them out and do remote learning at that time?
Maureen?
Well, actually, it would be easier going that way, because if you're already in a hybrid and you want to go remote, that would be fine. But if you were in remote and you want to go into the hybrid, it would be more difficult because there's only so many students, right, that are going to be allowed in a class. So that wouldn't, the reverse wouldn't work well. So we are still working to decide. There are some districts that once parents decide that they're going to do remote or they're going to do the hybrid, that they have to stay with that for the year. So we have not decided that, and that is something that we would work with school committee to make a decision on that.
Okay. Thank you.
All right.
Bob, you want to try?
Dylan? Oh, sorry,
Dylan,
I brought Dylan up. Yep. Dylan, if you could state your full name and city, please.
My name is Dylan Mosley. Can you hear me?
Yes, we can. Yep.
All right. My name is Dylan Mosley, and I play football. So, like, if we miss a season, will we be offered an extra year of eligibility?
Oh, that's a good question. Huh. Oh, Dylan, that's a good question. So that is a very good question. So the MIA has not given us any guidance on that. However, I think you could be in violation of the age 19 rule. So I guess you'll be asking, is the MIAA, if you are a senior, because you would have to be, you can't be 19 beginning the season starting in August, or you'd have to go for a waiver. So I guess your question is, if you were 19, right, would you be able to go for a waiver? You can go for a waiver. It'll be interesting to see what the MIA decides about that. But at this point, the discussion has not got to that level.
Dylan? No, you're still on mute, Dylan. Yeah, there you
Okay.
go.
Thank you.
All set?
Yeah.
Yeah. Okay. Bob, maybe Danielle?
Hold on, I've got to promote her. 1 second. Danielle, if you're there, could you unmute and state your full name and your city?
Hi, I'm Danielle Spence. I live in Shrewsbury and I work in Worcester. I'm a first grade teacher and I have concerns about the safety of myself and of course, first and foremost, our students. There's no masks that are required for first grade. And I understand while it will be difficult for first graders to keep masks on, I've now heard that we could be doing 3 feet of social distancing. So being in a room with 5 and 6-year-olds, them being together with each other with no masks on, with 3 feet, possibly 3 feet of social distancing. I don't think there's any of us here tonight that would go anywhere without being with household members and without a mask on, 3 feet distance to other people in the community. It is completely unsafe. The CDC, and I'm going to do a quick quote from the CDC. The Center for Disease Control recommends all people ages 2 years of age and older wear a cloth face covering in public settings and when around people